To share the screenshot for the role play situation for all three of you to know what exactly this situation is. Okay, so this is a case, patient Sunita, 58 years old, patient brought to hospital emergency 3 days ago with the history of jaundice. So to be very brief, she has gone into, she's gone into multi-organ failure, and her condition is really, not improving, and she's on life-saving drugs. The patient's family wants to move the patient, home. That we don't see any hopes. We want to take the patient. So Ramya and Ritika, you will be the patient's, say, sisters or daughter, whatever you want to. What would you prefer? What will you prefer? Being patient's daughter or sister?
Sister is okay.
Okay, fine. And Dr. Gaurang, you are the resident on duty. So do you want to see the case once again, or you're okay with?
I'm fine, ma'am.
Okay. Ritika and Ramya, do you need more details about the case? Fine. Okay.
Ma'am, I have a question.
Yes, please. Yeah.
As I read the case, now patient is already decided that they are going to go. So, I mean, let them go now. What is the discussion about? Of course, they are angry, I got to know, but they have finally decided that now they want to leave the hospital and want to take transfer.
Okay. So, one, it may not be in the interest of the patient. It may be that there's a possibility of survival. If the family has decided to go, it could be not in the interest of the patient. Second, I think we all know in hospitals, patients would come up with something like this, that we don't want this. But you think this is going to help the patient or is going to be beneficial for the patient. So your clinical goals are equally important. Patients' preference and their concerns we need to address. But then whenever we are, negotiating the agenda, clinical goals are to be kept in mind. We can't say, okay, we go by what you say. We have to try. We'll see in this role play. You'll get to see in this role play what exactly needs to be done. So I think we'll all switch off our videos, leaving three of them together. And Ramya and Ritika, you be the patient's attendant, like the way we see on day-to-day basis. And Dr. Gaurang, you try to strike, conversation as we normally try our best to talk to them. Whatever you think, if you want to go by Dr. Ila's point of view, that why the hell should I stop? Especially in government setup, when I ask my residents that, will you be asking the patient's family not to go Lama? They say, why? We need the bed. We need so many. So you can take whatever approach you want to do. So we'll switch off the video. Dr. Dipti, can I request you to switch off your video? So 3 minutes are okay?
Yes, ma'am.
Go ahead, please. Yeah.
Dr. Gaurang, you want to start?
Yeah.
So let's assume that both of you have gone into the ICU, Ritika and Ramya.
Okay.
Because he's sitting in the ICU and you have gone in the ICU. Yeah.
Okay. So we have entered the ICU.
Yeah.
We ask for the ICU doctor on call.
Yeah.
हमें उनसे बात करना है अभी की अभी.
हाँ जी बोलिए. My name is Dr. Gaurang. मैं ICU से हूँ. बताइए. How can I help you?
So the thing is, we have been here for very long. It's been over 15 days. She's been here and there is no improvement. चल के आई थी. She was doing much better initially. अभी तो लाइफ सपोर्ट पे है. क्या क्या चल रहा है, एंटी फंगल पता नहीं, बीपी की दवाई, वैसोप्रेसर्स पता नहीं क्या क्या चल रहा है. हमें कोई सुधार ही नहीं दिख रही है. ये कब से चलता है? हमको तो घर लेके जाना है.
I'm sorry, like आप मिस सुनीता की बात कर रही हैं, राइट?
हाँ जी.
ठीक है, बोलिए. देखिए मैं समझ सकता हूँ आपकी बात. I get your point, but मैं आपसे एक चीज बताना चाहता हूँ कि currently I understand situation पहले जैसे नहीं है. She has lapsed into multi-organ failure. But I want to tell you that we are taking good care of her. I want to assure you that. I understand your situation. आपकी क्या हालत है बाहर रह के मतलब I understand. अंदर रहना is different thing. बाहर सबको पता नहीं चल रहा क्या अंदर हो रही है. But I want to tell you she's in good hands and we're trying to do our best whatever we can possible. And why she's on life support currently is because जब वो आई थी she only had symptoms of liver disease, but it's progressed to acute liver failure leading to multi-organ dysfunction. अब उनके फेफड़े में पानी भरना शुरू हो गया है. Her kidneys are failing. Her liver is already crashed. That's one reason why her heart is also not functioning because her lungs are in problem. So we have put her on ionotropes. We have given her everything that we can do. I'm sorry, I'm unable to hear you.
Ramya, you are not. Dr. Gaurav, hold on. Dr. Ramya, your device I think is not connected, so we are not able to hear. I think you're saying something.
Yes.
Can you listen to me now?
Yes, we can hear you now. Yes, go ahead, please.
I just wanted to interrupt. सर डॉक्टर हम यही तो बोलने की कोशिश कर रहे हैं कि हमारी मम्मी हमारी बहन जो है दीदी उनकी तबीयत बिल्कुल खराब हो रही है और आप ही मान रहे हो देन आप हमें छोड़ती क्यों नहीं हो हम घर जाना चाहते हैं.
देखिए मैम मैं आपकी कंडीशन समझ सकता हूँ बट आई वुड सजेस्ट मैं रेकमेंड करना चाहूंगा कि यू डोंट टेक दिस डिसीजन इमोशनल होकर डिसीजन ना ले. अपने इमोशंस को थोड़ा साइड पे रखे आप एक मिनट ऐसे सोचिए कि वी आर ट्राइंग आवर बेस्ट टू हेल्प हर and there is a possibility she might slowly recover. It's a slow process but recovery is like the percentage of recovery is not nil.
मैं समझ कितना दिन लगेगा रिकवर होने में और घर वापस आने में आप कुछ गारंटी दे सकते हैं कितना दिन लगेगा.
देखिए रितिका जी मैं कोई गारंटी तो दे नहीं सकता. आई कैन नॉट गिव यू एनी गारंटी बिकॉज जितना भी साइंस एडवांस हो कोई भी ये प्रेडिक्ट नहीं कर सकता कि कौन किसका क्या कब होगा. The point is I'm only telling you that we doing whatever best I can. We are all doing whatever best we can and it will be a slow process but there is still hope and I want you all to understand that and try and see कि थोड़े से hope से अगर कुछ हो पाए तो भी हमें वो करनी चाहिए. I understand your situation but अब ये भी जानने की कोशिश कर लीजिए कि अगर आप उन्हें दूसरे हॉस्पिटल ले जाना चाहते हैं या फिर आप उन्हें घर ले जाना चाहते हैं there is a possibility she might crash. Like वो ऑलरेडी मल्टीपल सपोर्ट सिस्टम में है. शी इज ऑन आइनोट्रोपिक एजेंट्स. उन ड्रग्स के बिना कुछ काम होने वाला नहीं है. So she won't have any help when somebody is when you're taking her to the other hospital or when you're taking her en route home. What if something happens? She's in a critical situation where I cannot warrant a discharge as well. I understand being her patient party. आपकी final decision हम respect जरूर करेंगे. If you want to go against the medical advice, you can please go against the medical advice. We cannot force you. But I want to try my best to make you understand that it is not that we are in your shoes. We can wear your shoes and we are trying to understand what you're going through. But equally, you have to understand us. Give us that room and space to tell you that there's still hope and, I want you to trust us and hold back. But अगर
इमोशनल तो एक है फाइनेंशियल भी बिल बढ़ रहे हैं ये it's just never ending और आप कितने दिन और लगेगा that also we don't have any guarantee so it's just getting very difficult for us for our family to and we feel like they are prolonging her suffering also.
See, I'm sorry you're going through this situation. With regards to finance, I really cannot comment anything because it's your call and I respect that and I cannot cross that personal boundary. But with regards to her life with dignity, yes, I respect that as well. But you also have to understand that this is not the end. This is not the end. We are trying to do what we can, and we want you to at least give us some more time. Maybe you can buy us some time and see how it goes. But this is again on a trade-off basis. But I completely understand your situation. But I'm not in a position currently to discharge her as well. And if I have to go by the hospital rules, if you want to discharge her against the medical advice, then you will have to give it in writing. I understand me talking this is like really bad, but that's the reality because I'm bound by some authorities as well. So I would request you to reconsider your choice. But अगर आपको seriously लगता है कि finance is a problem.
Doctor, we are not able to, we are seeing there is no progress. You do understand? We both are totally not happy with the way you are treating my sister. And day by day, you are telling us so many complaints, which is adding up in my sister's health. And I have also consulted my friend, and she is saying, in her hospital, my sister can become okay. So we would like to shift to her. We are not at all happy with the way you are talking and the nurses are giving the care. So sorry, doctor.
I understand. I'm sorry if there was a behavioral issue or there was a communication error from my team or my staff or myself. I apologize on that note. But with regards to the treatment, I can assure you that we are going on the right basis, and we are treating her the way it is. With regards to her progress of symptoms, she came in an advanced stage, and the predicting the course of a disease is not in my hands. Whatever we could do, we are doing. But with regards to your second consult, if you feel that a second consult is going to do her wonders, I respect your choice. But I also want to tell you and warn you that it's okay you discharge her against the medical advice from this hospital to any other hospital. But what about the travel throughout the hospital, from this hospital to that hospital? What about, and what's the guarantee that it's going to be there well as well? Because looking at the situation, I can guarantee that progress is going to be really slow. I understand, if there was if the flaw in communication or with the attitude of my staff, I can understand. But with regards to patient, I can assure you that we are not erring anywhere. We want you to trust us and give us this chance. But again, as I told you, if finance is an issue and if trust is basically a problem, then I cannot help it. I would want you to take the call. But if you're taking that call, I also have, it's my duty to inform you that you will have to fulfill the procedures of going against medical advice, which is a hospital norm.
Thank you. Thank
So
you.
what do you say? Are you happy with the doctor's advice? Shall we make our sister stay here?
ठीक है, और 2 दिन देख लेते हैं, डॉक्टर इतना कह रहे हैं तो.
So,
Thank
She
you.
is very happy.
Can I request everyone to come in, please? Okay, so I think we'll start with Dr. Gaurang. Dr. Gaurang, how did you feel being there?
I've been in such a situation before twice as well during the COVID period, but I guess both my patient party have been really good. They were better than the actual real experiences that I had, because one of them actually literally was about to push me down. It was such a case, but yeah, I was happy. With regards to my advice, I guess I could have articulated a little better, given them a flow, and I don't know. I would want you guys to comment on.
What do you think you did effectively? You did a lot of good things, but can you think of the things that you did effectively?
I think first and foremost, I gave them this confidence that I was listening.
Mm-hmm.
Second, I gave them this confidence that it is not me being a doctor and speaking here. I can be a pillion patient too and speak for them. Just that I know the doctor stuff, and they're not aware of the doctor stuff. But I can go get into their shoes, feel how they are. Once I give them that trust, I believe they will be convinced. Third, I think I broke it down into I broke things, because finance is something that I would never comment for anybody, not even my own parents or siblings. So I will not comment it for a patient. So me drawing a line would have given them the confidence that probably I'm not trying to be this money-minded doctor that I am. But with regards to other things, I ensured that I took a neutral stand of listening to them, at the same time ensuring that I communicate what my hospital rules are. Because if I just tell them in a harsh tone that no, okay, chahiye to jao, just give it in signing. Agar patient mar gaya, I'm not responsible. If I had told it that way, they would have definitely not accepted it. They would have again, they would come back with a greater force to somehow crash me down. Absolutely. But since I played that neutral thing there, I also told them that hospital demands this, because I have a respondent superior. I played the role that way. I have a respondent superior. Sorry, I'm helpless. I cannot do it. At the same time, I told them this was probably 3-4 things which I did. I feel so.
Wonderful. I think you did a lot of good things, and people are actually commenting and complimenting you for the way you handled both of them. Let's listen briefly from Ritika and Ramya. What do you think Dr. Gaurang did well that really, almost quietened you, and you were not able to argue or become aggressive with him or actually force him to we don't want, we just want to go.
He gave me
I
little
saw that you
hope
were
that my
calming down.
sister can get better, and he seemed like sincerely, dedicatedly, wanting us to stay. It could have been easy for him to say, "हाँ लेके जाओ." It could have been, but he really convinced us that he can do something different. Give me time. He said, "Let me buy me some time. Let me see if." So that was something that I thought, okay. And he totally said he can't talk about the finance thing, which I also understand is not his job. So it was good when he reassured me that yes, he cares genuinely about the case and he saw hope in it. He convinced me that there is hope in it.
Absolutely. Ramya, anything from your side?
Dr. Gordon did not allow us to talk. He was actually, whatever questions we were going to ask, he was readily answering the things. So we didn't have any dialogue to go on. So that is a positive thing. So when you allow people to talk, they will go in a ahead manner. So he has answered all the questions. So we never had a dialogue with him, but definitely a convincing conversation was there for the patients.
But would you prefer a dialogue or a monologue?
No, here we are very angry and the doctor is trying to convince us. So in this situation, the way Dr. Gaurang has handled the case was better.
Yeah.
All the answers were given.
He heard you well. Then he tried to explain you everything in very simple and clear manner. And he was not false, assuring you.
Yes.
Of course, there are a couple of things that I want to ask the group. What do they say? Is it how safe it is to say something like this? And how can it put us in trouble? Because this is something we have to remember. But I think a lot of good things Dr. Gaurang did well was about the way he was listening, the way he was talking to the family, the way he was addressing their concern, and even the financial concern. Although he said that I can't comment on it, but then if the family says that that's our concern, then is there a way to even discuss that part? I want to even ask that question to the group. So I want to keep the discussion very brief but very crisp and very useful, because this is a very important activity. Just 1 second, Dr. Gaurang, hold on. So but I want very valid and useful points. If you have to add nothing that has been already discussed or given me your comments, although I can read your comment very clearly, that where you are saying that it was very nice counseling and your conversation was so convincing, active listening, counseling, focus was on the clinical proposition, tone was good, absolutely. Wish all doctors would react in the same manner, even in the bad situation. Again, people are saying active listening, empathic discussion, tone of voice was excellent. You were not authoritative or intimidating or aggressive with them. That is absolutely right. And the way you were explaining is that really, really works. See, if you could make them calm down, even in real life situation, when you help them see their, your perspective in a very honest manner, they would understand. And of course, you showed responsibility. That's again a good thing. I want to talk about this. How much of responsibility can we take, or should we be taking? Because a lot of time, out of compassion and concern for the patient's welfare, you may take a responsibility which you can, tomorrow fail and they can catch hold of you. So I want to ask you about that. And then, of course, he was empathetic. Absolutely. I think most of the comments really talk very highly about what you have said. But my question to now, to you, first of all, Dr. Gaurang, very specific question. What do you think you did which could put you in trouble?
I was setting a kind of trade-off, like I wanted to buy time. So since I wanted time, I actually trade time.
So buying time, Gaurang, I'm asking you this question again. How much of buying time is seen as something that you really want to do out of compassion and care for the patient? Or is it that I'm buying time because I want time? Because it can actually completely change the way the patient party will look at you. Tomorrow they'll say, आपने कहा 2 दिन रख दो, हमने रख दिया. आपने कहा इतना खर्चा और आएगा, हमने कर दिया. Now where is the patient? Tomorrow, unfortunately, if the patient dies, somebody's mic is on. If you can please put your device on the mute mode. Yeah. So if in case you say something like this, trust me, give me some time, you are going to be in trouble if you make such statements. So in a very neutral tone, we can say, in such situations, we do see improvements, but that only time can tell. If you agree to leave the patient for another 2-3 days, the care that we are giving, again, I assure you that I'm giving you a best treatment. I would rather say I'm following the standard treatment protocols. If you want, I can give you a summary of the work that we are doing with the patient. You can consult anybody. You can go for second opinion. If you have a doctor in family or somebody who's well-versed with medical subjects, if you want me to speak to them, I can talk to them and explain what all we are doing for your patient. The word assurance is very risky sometimes. It is sometimes taken as though you are guaranteeing. Although the term guarantee you use very, very smartly. You said there is no way I can guarantee you. There's no mechanism that can give me where I can give you a guarantee. Use that, you handled it very well. But even assurance can sometimes go against us. So we have to be very careful when we are. Anything else, Dr. Gaurang, you think you did which need to be,
Yes, ma'am. Like when Dr. Ritika was saying, it just struck my mind. So when they said they are patients' sisters and wo aate chalte aa rahi thi, now she's going on multi-organ failure, she's taking the first question I raised was, "Kya aap Sushila ji ke relatives hain?" I think this very basic question, when you ask them and they get a sense of feeling that you're acknowledging the patient as a patient. Most of the time, I have seen the doctor saying, "Ab kiski baat kar rahe hain?" Because everybody is life support.
Absolutely.
So if you have some basic idea, then she has a feeling that, okay, he is responsible, he identifies me as Sushila's relative, at least from the patient or whatever it is. So that way, I think that is a very first goal. So I think if that's stuck, then obviously subsequent conversations are going to be easy. So that was one thing I wanted to add, but I agree, ma'am. I think the word
to start with, you did say that, oh, you are Sunita's patient relatives. You did say that in between, and definitely that goes in our favor. So now I would request everybody to write in the chat box one thing that you think Gaurang could have done differently to, make the whole thing better, or you think which is little risky and one should avoid, or we could have used the other way. Please write in the chat box. I know we are short of time, so I'm asking you to write in the chat box to have more answers. Yeah. Monica, I'll come back to you. I know you are raising your hand. Give me a minute. I'll come back to you. Yeah. Very nice. I think some of the observations are very, very accurate. When you immediately apologize on the behalf of your staff without knowing they really need apology, at times they become, more dominating in the situation, because they were females. If they were male, they could have seen this is what is the treatment your staff is giving to us. So we have to be careful before we, So taking responsibility on behalf of other staff member, yes, I think that's something we have to be careful about. You could have, yes, I think this is one thing we as Indian doctors and Indian healthcare providers need to learn is we do most of the talking. What I've learned in my training with the Academy of Communication Healthcare, that reminds me, I've received my certificate of completion as a relationship-centered communication facilitator. So that was something like, I thank you so much. Thank you. Thank you. So for 6 months, I've been working on it. I had my pilot workshop with the Dr. Dipti Goswami and her team of doctors from Maulana Azhar Medical College. And Dr. Dipti, thank you to you, because you were the part of the last part of the training. And fortunately, everything went well.
It was entirely my benefit.
My pleasure, my pleasure. Thank you. So I've received my certificate. So what I'm trying to say, what I have learned with my, from my training with the Western communication trainers is we are in habit of doing most of the talking. I think that if you can change, it will give you a lot of benefit. One, you save energy. You save time. if you are able to ask their concern, like Dr. Ela has mentioned, that if you had asked what are their concerns, why do you want to go Lama? Then you could have been very specific in giving answers to those concerns rather than giving a buffet. What we do when we do most of the talking, we provide the buffet. We are giving them all information, required or not required. And sometimes what they don't require, if we are giving them, that can go against us in the next situation. So asking them, why do you want to go? What are your concerns? What is bothering you? I think this shift, if we can bring in our approach, will save a lot of time, a lot of energy. And when you allow them to talk, a lot of their anger and anguish gets ventilated. And they will become calm also. Oh, the doctor was very nice. He heard me. Nobody is ready to listen to what I want to say. They just want to tell us everything is fine, wait for a while. But he really asked me, what are my concerns? And then one by one, you can, address. So I think that was a very good observation, Dr. Ela. And I think this is one change we really need to. Okay. He could have heard the monetary part, which I completely agree. I think, again, this is one area where we are weak. We are not comfortable talking about money, especially for doctors. I get to hear from almost all the hospitals where I do programs that when it comes to talking about the financial part of the treatment, they normally fumble and they are not able to clearly say, because somewhere we underestimate ourselves and our facility and our care and the value of we are adding to the patient's life. I remember in one of the hospitals, they said that doctor will say, okay, this procedure will cost you 2 lakh rupees. And when the bill comes, it is 3.5. The family fights. The doctor said 2 lakh rupees and you are charging me 3.5. Then later on, they explained that 2 lakh rupees the doctor's fee and the procedural charges, and 1.5 is for the stay and the treatment and nursing care and other OT and other. Why not tell it right in the beginning? But we will talk about it, how the financial matter can be talked. We'll speak that in a minute. But I agree, we have to become comfortable. Involve the team while counseling if needed. Dr. Birender, team means you mean the patient's party, or you want to call the team?
No, what I want to say is if it gets more difficult, so the one who is counseling should also have equal concern for himself or herself and not take too much on their shoulders, and try to have a colleague or a senior also come into the picture, so that the team is first tangibly visible. There could be others who could add up some more value to the whole thing. The only caution that has to be there, that they should understand the perspective there, what's going on, and they should not just suddenly come out.
I think that is, if it is just one family member or two family members coming and requesting the doctor on duty. So what we are trying to showcase through this role play is like you are the first person whom the family has come with the request going Lama. Maybe if they don't agree, then you'll say, okay, let me speak to the consultant and I'll see if you can speak to the consultant and discuss your concern with him. Yes, that can be escalated to the senior level, I agree. But at this point, I think we are considering in our individual capacities, how can we deal this situation effectively? I think I agree with you. So he said the patient is in bad condition and there was no improvement, but still he made patient okay. Again, Dr. Rame is saying that in case the patient dies, there is a possibility tomorrow their family will say that you knew the patient was not going to recover. You had already told us that the chances are very low, but you still kept the patient. So that means if the patient party is not very clear about your intentions, there can be a confusion or ambiguity. Yes, Dr. Dipti, I'll come to you in a minute after Dr. Monica. So a lot of assurance were given and things were actually not that much under control. It may give a false hope. I completely agree. I think this is something we have to be very, very, careful about. I think a lot of good observations we have received. Yes, Dr. Monica, you want to say something?
Yeah, ma'am, my question is regarding the setup, whether the conversation was for the corporate hospitals or for the government, because I think then we have two different scenarios where generally in government hospitals, the tendency is to let the patient go off. Because जैसे bed की ma'am shortage होती है, manpower की shortage.
Yeah, Dr. Monica, actually you joined slightly late.
तो वहाँ पे मैम मुझे लगता है कि सिनेरियो बहुत चेंज हो जाते हैं दोनों situations में. तो ये मेरा question है मैम.
Yeah, Dr. Monica, you joined slightly late. This discussion we already had in the beginning, and you're right. In this case, the family was talking about money, so naturally then it comes down to a corporate setup or a private setup and not government setup. But yes, I agree with you, and this is what we discussed in the beginning, that in a government setup, usually people are wanting to, because they're already short of bed and there are so many other patients, whom you think you can save and provide better services. So, but then again, it's risky if you allow them to go, and also if you allow them to go, and in that case, if you're saying something like this, आपको ले जाना है, ले जाइए, कल को मुझे मत blame करिएगा कि patient की death हो जाए तो कागज है, आपको sign करके जाना पड़ेगा. So again, it's very dangerous when you make such statements. Tomorrow there can be aggressive reactions because of this. Yes, Dr. Dipti, you wanted to say something. Go ahead, please.
Dr. Indu, like this is a patient who is in a bad state anyway, and with poor prognosis. I will just discuss. I had a patient whose prognosis, whose baby's prognosis, I thought is not so bad. A 33-weeker who delivered, and it was some known to patient, some known to some senior faculty's worker, wife, whose previous baby was also dead and a cesarean was done elsewhere. Now she came, she was throughout in my care, my antenatal care, and 2 days back she came at night in labor, and we suspected that a scar is giving way, and we took a section out, and baby was 2 kg plus and 33 plus, between 33 34. And by my experience in our nursery, we are mostly able to save such babies. All right, so even then I spoke to the doctor and said, yeah, well, your worker's wife, I think it should be all right. We have had problem, but the mother is safe and the baby is at this gestation is not too bad, and it's, let's see, let's feel the fingers crossed, but the baby should come out. So I gave an assurance based upon our past experience with our nursery's outcome. And today on the rounds, morning, first thing I got to know that the baby is no more. That baby has passed away. So it was a shock to me. Of course, I went and discussed with the neonatologist, and he said, well, ma'am, something to do with prematurity, plus there was some early onset sepsis. Now, sepsis means it is something wrong with our setup.
Yeah.
See, now the patient is uneducated, but the patient has come through a learned professor who was a HOD neurology, and no personal family known to also. I tell you, I did not call him up till 3 p.m. because I was struggling in my mind what I am going to tell Dr. Puri, what has happened to that baby. So अब now अगर मैंने उसके रिलेटिव से बात नहीं करी, क्योंकि मोस्टली मेरी उनसे थी, मेरी टीम की दूसरी कंसल्टेंट रिलेटिव से इन टच में थी. Now once you prognosticate that probably the baby is going to be okay to a mother who has already lost one baby earlier, and now this happens, I think I was struggling with words what to say. I could just say sorry. I just didn't have anything.
I think what you have discussed or what you have brought to the table is absolutely what we are trying to say, that if there's a possibility of even, remotest possibility of poor prognosis, and if you have given this assurance, in this case also it was a clear-cut case, and this is a real case what I've shared with all of you. Somebody very, very close to
me. Today morning. I mean, I could make out with the doctor's
voice. We really have to be very careful about the words, because you cannot take responsibility for everybody. You can't take responsibility of the septicemia that can happen because of somebody's mistake, or the neonatologist if messes up something, or there's something wrong in the nursery ICU, or a neonatal ICU, like whatever. So again, you have to be really very careful when you are giving assurance to the family. See, whatever best is possible.
And the thing is, even if we say in a balanced word that it should be okay, though we cannot predict, they will remember the first part. They will not remember the second part.
Selective listening. Selective listening, selective remembering. आपने कहा था बच जाएगा, आपने कहा था यहाँ इलाज करा लो, अच्छी जगह है. So they will not forget that. So the thumb rule that we have to follow is, please promise less and deliver more. If you promise less and deliver more, people are going to be happy. But if by chance you have promised something in a very casual way, it's fine. Don't worry. She should be fine. I don't see any problem in this. We have no idea. Even small test dose can kill a patient. We have seen this happening. Medical subject is very unpredictable, especially gynae ops, though it's considered most unpredictable. So we have to be really very careful.
And I mean, even at the senior most level, I feel I'm in control of things. I'm giving best of the care. I've done a section immediately. Yeah. I called a senior neonatologist. The baby's ABGAR is not bad. Baby's weight is okay for the gestational age. Everything is fine. And it's just that, like, you know, ऐसे तो हम किसी भी, I feel that to any obstetric patient, I can't say anything. I shouldn't be giving hope. I mean, it's so difficult where to strike a balance. How much, if I can struggle at my level, I mean, I wonder what my residents feel.
Absolutely. So true. I think I completely understand and agree with what you are saying. So I think Dr. Gaurang gave us a very good, Dr. Monica, do you want to say something more?
Yeah, ma'am, I just have a small query. Is it good to respond to the comparisons? Like sometimes what the patient attendants do, कि उस hospital में तो ये हो रहा है, उस hospital में तो कम charges हैं, उस hospital में तो ये care promise करी है. Is it okay to respond to
it is not a good idea to get into, discussion on this, because you don't have any evidence or they don't have any evidence. It's going to be an endless discussion and it will end up into argument and blame game and then, washing your dirty linen in public with people. Not a good idea. The best way to do it, see, I think you can evaluate. I can talk about my setup. I cannot talk about any other setup. What they do, how they are doing. I'm sure they must be doing best in their capacity, but they have their own ways. We have our own ways. I can talk about my setup. So rather than doing any comparison or discussion, you can just cut the. So even the financial part where it came that we can't afford, and in private setup, a lot of time patients will say we can't afford the care. So if you are genuinely concerned about the patient, maybe there your point will be, in case if you cannot afford to keep the patient here, I understand. I would advise you to still move the patient to a government setup where the patient can be attended. The idea is that if there's a possibility of life, I would like to give a chance to the life. Even if it's she's 58 years, we do have cases where people have come out of such situation. We can consider, but I understand your concerns about your financial constraints. You can consider taking the pay. So what you are doing, you are not talking about the money, but you are explaining them that what is the other way out to handle it. Yeah, Ramya, you have a question? I think then Dr. Virender. Okay, Ramya, go ahead.
Yes, ma'am.
Yeah.
So actually, when the patient is in such a situation where we are not sure the patient is going to die or not die, and the doctor is not giving an assurance, so they might go to the nurses community to ask whether what is my patient's सच्ची में बताओ डॉक्टर तो मुझे बात ही नहीं कर रहा है, एक बार करते हैं बात, मतलब the nurses are in constant touch with the patient. So in that scenario, how the nurses also should support, or they that's what I wanted to know, because this question comes to us a lot of times.
Absolutely.
And they trust us more than the doctors, because 24 hours you are with them. So they understand us.
So without giving any direct yes and no answer, you have to be, explaining the situation. See, this is what is the situation, and this is what the doctor is doing, and this is the way to handle the situation. Again, you are in a way reiterating what the doctor has said, but maybe you're giving a chance to the family to talk more about it or ask you some more questions, where when you will explain, when like Dr. Gaurang was explaining about multi-organ failure, maybe the family is not educated, they will not understand. But when they come to the nurse and the nurse says, देखो kidneys काम नहीं कर रही, जब पेशाब नहीं आता ना पेशेंट को, इसका मतलब है kidneys काम नहीं कर रही है ना. बीपी बहुत कम है, बीपी कम होने का मतलब है कि पेशेंट की जनरल हेल्थ बहुत वो है, या उसका हार्ट काम नहीं कर रहा है, लंग, whatever. So when they explain, the patient's family gets a chance to ask and talk a little more, and then as a nurse you get an idea about what is happening in the patient's family's mind. You are a feeler, of the situation, and then you can communicate to your doctor that this is what I can feel. I want you to, intervene or take appropriate action, or counsel the family, talk to them. If they're aggressive or they're dissatisfied, all that can be dealt if the sensors around the setup can communicate to the team upstairs. Yeah. Yes, Dr. Virender.
Ma'am, I think at the tail end of your last talk, you have already touched that point. So at some point of time, that is what I meant, at some point of time, the bigger team needs to get involved. And the doctor, the one who is dealing with the situation, I know the scene was primarily how do you counter when you are, yourself facing something like this, and as one person there, you're handling it. But you need to also know not to handle more than required, and then not to handle more than required. Many people have already mentioned this, and you have talked about how much responsibility we should take.
Yes.
And it's not necessary that the entire conversation should end in a result then and there. So we will have to also divert some part of the conversation and then again reach to the part two later. I mean, we should not isolate the financial part, but yes, we should say that we can sit down with you and look at how you are planning and then involve another expert into the thing. So that gives a breathing space to both the counselor as well as them also, that they have got some support. More than nurses, again, beyond a point, will not be able to deal with it, except for a few nurses who, pick up very well.
Yeah.
They are aware about the nuances of finance or the cost and everything. So, cut short, I'm just saying that it was a good counseling, and then, as the points were mentioned, they're really very correct.
Yeah.
But doctors do tend to take a lot on their shoulders. They try to complete everything then and there, and there are certain pressures, which I don't want to name here. So I think we will have to be wise and also involved at some point of time. Say it's a multi-organ patient.
No guidelines can be the final word.
Yeah.
Guidelines are meant to just help you take a call when you are in the moment. So these are just ideas that we are trying to, bring up and discuss so that it is there in your conscious mind. And when you are in this situation, like for example, this example Dr. Dipti has shared with us, it clearly shows that, okay, I mean, even if everything looks okay, do not give assurance where you can be in trouble tomorrow.
Right.
So these are the learnings actually to be taken from such discussions, that we can't predict, we have no control. So saying, give me time, give me some time, let me try again. Why do I want to try? No, I'm leaving it to you to decide whether you want me to try or not. I would rather say, see the chances, but how I say is very important. I am with you. We are together. We are one team. If that's what you can, emphasize on, I'll say, see, I know the condition is very, very, sad. I completely agree. I'm not denying. But at the same time, even if there is 10% possibility, I would say we can try. But it's you who needs to take a call if you want to try or not. So what you're doing, see, again, we are in habit of deciding on the patient's behalf. We have to actually unlearn that. We have to come out of that mindset where we decide on the patient's behalf. No, our responsibility is provide all the information. At the most, if they ask your opinion, what do you say? Had it been my sister, I would not have moved her. I would have, tried my best to say, if you're asking for my opinion. But it's you who needs to take a call. If you need some more explanation, information, I'm ready to provide you. But discuss with your family members and take a call whether you want to take the patient home or not. So let's put the ball in their court rather than. So the whole idea of this role play was one, of course, how do you handle uncooperative patient party? Of course, Dr. Goran gave a very good example of being a very patient doctor, very, who tried explaining, who tried listening, who tried convincing, who tried even going out of the way in, telling them that they should not take the decision of going Lama. But I think in reality, it is much different. As Monica said, in government setup, we are very quick to say, "Aapki marzi hai, le jana, le jaiye." And when we say, our facial expressions also show, I don't care, it's your choice. Even in private setup, I think at the consultant level, maybe you would want the patient to be retained as long as you can. But at the resident level, even residents say, "Aapki marzi hai." And the expression, again, they will have absolutely, no expression face. So again, that can create, ambiguity, that is this doctor not concerned or not sensitive or not even responding in the right manner. And a lot of time we become aggressive also, especially when they start finding fault with our way of handling the patient or the family. आपके यहाँ कोई सुनता नहीं है, सिस्टर आपकी बात नहीं करती है, सिक्योरिटी गार्ड आपका बहुत बदतमीज है, बाहर बैठने की जगह नहीं है. I think these all things would also pop up when we are having the discussion. So it adds to our, kind of insult to injury, and then we also become aggressive. So to any difficult situation like this, we all handle in 4 different ways, if I may broadly say. One is if the family says, I want to go, and we say, le jaiye. Second could be, if you want to go, we'll say le jaiye, but at the back I will talk ill about the patient and the family and everything. ये बहुत बेकार लोग हैं, useless लोग हैं, ऐसे हैं, ऐसे. Third, I may become aggressive. Fourth is the right way of handling. So all this I want to show you through 4 videos that are more like my home production. And I've tried to deal with the same situation in 4 different ways to help you see how we normally handle and what is the right way of handling. And then we'll go ahead with the discussion. Give me a second.
मैम बेड नंबर 7 पे पेशेंट जाने के लिए कह रहे हैं. कहाँ? दूसरा हॉस्पिटल जाने के लिए कह रहे हैं. उनका जो रिश्तेदार है. क्या कह रहे हैं? कह रहे हैं डिस्चार्ज कर दो, दूसरा हॉस्पिटल जाएंगे. वो जो उनका बेटा है, जो उनके साथ जो है ना, वो कह रहे हैं वहाँ दूसरा हॉस्पिटल में. एक बार आपसे बात करा दो. बात कर लीजिए. जाने दो, क्या करना है, कौन से कपड़े करेगा, छोड़ो करो. डॉक्टर राकेश को बोलो डिस्चार्ज स्लिप बना दे. आप अपना बेड क्लियर कर लेना. ठीक है, बना दो डिस्चार्ज स्लिप, बनवा दो.
So let's see all 3 videos, all 4 videos, and then discuss the difference between all 4.
मैम आजा. मैम बेड नंबर 7 पे पेशेंट जाने के लिए कह रहे हैं.
कहाँ जाना है?
दूसरा हॉस्पिटल जाने के लिए कह रहे हैं. केवल डिस्चार्ज कर दीजिए, दूसरा हॉस्पिटल.
कौन कह रहे हैं?
उनका बेटा साथ में है.
वो जो टाइम के साथ रहता है. वो है ही बदतमीज, वो बिल्कुल बेकार आदमी है. हर वक्त कुछ ना कुछ उसको नया ही सोचता. अब क्या कह रहा है वो?
डिस्चार्ज कर दीजिए, हम दूसरा हॉस्पिटल लेके जाएंगे.
तो वहां जाके क्या इनको बहुत बढ़िया कुछ वो मिल जाएगा क्या? यहाँ पे इनको क्या तकलीफ है? क्या कह रहे हैं यहाँ पे, क्या दिक्कत है उसको?
बस हमारे डिस्चार्ज कर दीजिए, हम दूसरा हॉस्पिटल जाएंगे.
नहीं तो वहां पे क्या, यहाँ पे इसको क्या दिक्कत आ रही है? कुछ बता रहा है कि क्या क्या प्रॉब्लम है उसको?
नहीं, ऐसा तो कुछ बताया नहीं.
कुछ बोला नहीं. अरे ये शुरू से ही ऐसे ही बोल रहा है. ये वहां तंग करने वाला बंदा है, किसी काम का नहीं. दे जो ऐसे बंदे से क्या करना है हमने. और लड़ाई करेगा, जितनी देर ये यहाँ रहेगा तंग ही करेगा. कभी मेरे पास आता है, कभी कहते जी सिस्टर ऐसे कर रही है, कभी कहते हैं जी सिस्टर वैसे कर रही है, कभी कहते हैं जी पर्दे नहीं ठीक यहाँ पे, कभी कहते हैं जी एसी नहीं काम कर रहा आपका. बार बार कंप्लेन ही करते हैं. भेजो इसको, और राकेश को बोलो इसकी वो बना दे.
बात कर लीजिए.
क्या बात करनी है? बदतमीज आदमी है, जाने जान छूटेगी. कुछ बोलना मत उसको. उसको कह रहे हैं ठीक है आप बना के. डॉक्टर राकेश को बोलो उसकी डिस्चार्ज स्लिप बना दे और बिल क्लियर कर देना अपने. ये जो जाने दो, ऐसे लोग जाए ना ही रहे तो अच्छा. सारा दिन से खपाई करनी पड़ती है वजह से. ठीक है, तुम्हारा क्यों मुंह उतर गया? जाओ जाओ जाओ, जाने दो.
मैम आसू, मैम बेड नंबर 7 के पेशेंट जाने के लिए कह रहे हैं।
क्यों?
डिस्चार्ज मांग रहे हैं, फिर हम छुट्टी करके हम दूसरे हॉस्पिटल जाएंगे।
फिर क्या तकलीफ है उसको?
फिर छुट्टी करते हैं, मैं दूसरे हॉस्पिटल जाएंगे।
यार बहुत ही पागल आदमी है, हालत पेशेंट की इतनी खराब है, छुट्टी करो, रास्ते में कुछ हो गया तो क्या करेंगे?
उनके साथ जो अटेंडेंट है वो कह रहे हैं कि हमारे डिस्चार्ज है।
उसका जो बेटा है जो उसके साथ हमेशा बैठता है, बहुत ही बेकार आदमी है। जब देखो इसको, पहले तो इतने नखरे इतने हैं, कभी एसी काम नहीं कर रहा, कभी ये नहीं काम कर रहा, अब छुट्टी कर दो, छुट्टी कर दो।
आपकी बात करा दे,
भेजो इसको, जरा सही करो उसको, भेजो जरा। क्या तकलीफ है भाई, क्या हुआ है?
मैम डिस्चार्ज कर दीजिए।
तुम्हें उनकी हालत पता है इस वक्त क्या है?
बहुत दूर पड़ता है, आने जाने में दिक्कत होती है, इसके बाद डिस्चार्ज कर दीजिए।
नहीं तो हॉस्पिटल तुम्हारे घर के पास ले जाऊं, डिस्चार्ज कर दो। उनकी हालत इतनी खराब है, रास्ते में कुछ हो हवा आ गया ना इधर के रहोगे ना उधर के रहोगे। ज्यादा दिमाग मत चलाओ अपना। इलाज करवाना है तो शांति से करवाना चाहिए, ऐसे नहीं कि इधर भागो उधर भागो।
इधर आने के लिए ऐसा लगता है, और इधर आते ही बहुत ज्यादा भीड़ हो जाएगा, तो पैसे है नहीं हमारे पास।
तो पहले ही सरकारी में चले जाना था, यहाँ आने की क्या जरूरत थी? आधा अधूरा इलाज करके अब जहाँ जाओगे तो वो लोग तो कहेंगे ना कि ठीक से इलाज नहीं करा उन्होंने, मेरा भी नाम खराब करोगे, रास्ते में पेशेंट को कुछ हो गया और मुसीबत हो जाएगी।
आप डिस्चार्ज कर दीजिए।
भैया बहुत ही बेकार आदमी है तुम तो। डिस्चार्ज तो मैं कर दूंगी, बट दोबारा मुड़ के मेरे पास बताना। ये कोई तरीका नहीं है इलाज कराने का। अपने में पेशेंट का भी नुकसान करोगे और मेरा भी नुकसान करोगे साथ ही साथ में। हमारा आदमी है। सिस्टर,
हाँ जी,
इनकी डिस्चार्ज स्लिप बना दो और बिल क्लियर करो इनका, और भेजना इनको। जाओ, और दोबारा मुड़ के मत आना मेरे क्लिनिक में। पता नहीं कहाँ से लोग आ जाते हैं।
मैम आ जाओ इसमें। मैम बेड नंबर 7 के पेशेंट जाने के लिए कह रहे हैं।
कहाँ जाना चाहिए?
दूसरा हॉस्पिटल।
छुट्टी के लिए कह रहे हैं?
हाँ जी।
जो उसका बेटा जो साथ में वही होता है उसका। भेजो उसको, मैं एक बार इसी बात पे भूपेंद्र नाम है ना आपका? आप उनके बेटे हैं जी। क्या हुआ इधर?
जी मैम डिस्चार्ज कर दीजिए।
कहाँ ले जाना चाहते हैं?
जी मैम किसी दूसरे हॉस्पिटल में जाने जो अपने घर के पास में होगा, वहाँ से आने में बहुत दूर पड़ता है, और जो पैसा है उतना है नहीं, मैम आने जाने में खर्चा बहुत हो जाता है।
देखो बेटा, अगर आप कहोगे छुट्टी कर दो मैं कर दूंगी, मुझे कोई दिक्कत नहीं। तो मैं आपको ये बताना चाहती हूँ कि इस वक्त उनकी हालत जो है वो लेके जाने वाली नहीं है। क्योंकि एक तो जैसे यहाँ से अगर आप लेके जाओगे तो रास्ते में एम्बुलेंस को लेके जाओगे, कैसे होगा कुछ नहीं कह सकते, क्या सिचुएशन होगी कुछ नहीं कह सकते। मतलब हालत इतनी अच्छी नहीं है, ठीक है। थोड़ी भी ठीक होती है तो मैं कहती चलो ले जाओ, कोई बात नहीं। तो एक तो सबसे बड़ी बात ये है। दूसरा ये देखो बेटा, जैसे पिछले हफ्ते से हम लोग इलाज कर रहे हैं तो हमें काफी हद तक उनके बारे में पता है क्या उनकी कंडीशन है। अब नए हॉस्पिटल जाओगे, नए सिरे से कोई इलाज करेंगे, मैं बेशक तुम्हें पर्ची बना के दूंगी, उनका सारा डिस्चार्ज लिख के दूंगी, जो जो ट्रीटमेंट है। तो फिर भी एक होता है, एक डॉक्टर जो ट्रीट कर रहे होते हैं उनको पता होता है कि इस वक्त इनकी किस दवाई से इनको फायदा हो रहा है, क्या इनको नहीं सूट कर रहा। नई जगह जाओगे तो फिर वो नए तरीके से सारा हैंडल करेंगे। तो देखो एडवाइजेबल तो नहीं होता बार बार डॉक्टर चेंज करना। और मुझे ऐसा भी लग रहा है कि पिछले 2-3 महीनों में थोड़ी, अगर आपने नोट करा तो उनकी कंडीशन में इम्प्रूवमेंट भी हुई है ना।
इम्प्रूवमेंट तो हुई, बट उनकी पैसे वाली प्रॉब्लम आ जाती है।
देखो बच्चे, ये तो मैं मानती हूँ कि प्राइवेट में तो खर्चा आता है, अगर जहाँ भी लेके जाओगे वहां भी खर्चा तो आएगा ही आएगा, ऐसा तो है नहीं कोई फ्री में हो जाएगा। अच्छा, सरकारी में अगर जाओगे तो वहां पे आपको पता है वहां पे इतना पेशेंट होता है कि आपके पेशेंट को बेड मिलेगा नहीं मिलेगा कुछ गारंटी नहीं है ना।
देखो मेरे से पूछोगे अगर तो 2-3 दिन की बात और है, यहाँ इतना सह लिया, ये भी आप कर लो। बहुत मुश्किल है और लेके जाना चाहते हो फिर तो बेटा मैं जिद तो नहीं कर सकती तुम्हारे साथ, तुम्हारा पेशेंट है, तुम्हारी फादर है, तुम्हें डिसाइड करना है कि क्या करना है, जो भी करना था तुम कर सकते हो। मैं कहूंगी ये कि घर पे एक बार सलाह कर लो, अपने बाकी जो लोग हैं उनसे बैठ के सलाह कर लो। क्योंकि मेरा कहना ये कि जो 2-3 दिन की बात है, जब हफ्ता निकल गया, 2-3 दिन की बात है, फिर भी कहोगे तो मैं कर दूंगी छुट्टी, मुझे कोई दिक्कत नहीं, मैं पर्ची बना दूंगी, पता कर लो जहाँ बेड है, इतना खर्चा कम आता है, फिर आने ले जाओ।
जी हाँ, वैसे आपने तो सही कहा, वैसे एक बार जाके घर में मैं डिस्कस कर लेता हूँ मैम, और पता करता हूँ कि 2-3 दिन की और बात है, और इम्प्रूवमेंट भी अच्छा हो रहा है उनका, तो शायद हो सकता है कि खर्चा थोड़ा एडजस्ट कर लेंगे तो हो सकता है सही हो।
देखो बेटा हॉस्पिटल में खर्चा तो होता ही है, ये तो है नहीं कि फ्री कहीं काम होगा। वहाँ सरकारी में जाओगे तो वहाँ टाइम ज्यादा लगेगा या बेड नहीं मिलेगा, प्राइवेट में जाओगे तो 19-20 का फर्क आएगा, ऐसा नहीं क्योंकि जमीन आसमान का। फिर भी आप सलाह कर लो, मुझे बता देना, ठीक है?
थैंक यू।
अच्छा। So this was to just give you an idea about 4 different ways we handle this situation. So you did that questionnaire on communication style. All of you have done it. And all of you have your 4 scores ready. Can you write in the chat box your scores so that I can explain you your scores?
Scores for all the 4.
Yeah, with a comma in between. Write all 4 scores with a comma in between. I'll explain you what exactly those scores are. Yeah. So if I may explain you, your first scores are your passive communication scores. You can write in your notebook in front of this course. Your first scores are your passive communication scores. Your second scores are your passive aggressive communication scores. Third scores are your aggressive communication scores. And the fourth one is your assertive communication scores. Now, if I can see your scores, most of you have received highest scores on assertive communication, the last one. So that's a good news. That's a good news that most of us use assertion in our communication with people around us. But the second half of the truth is your second highest scores is your backup plan in a situation of conflict. So you will try assertion, but in case if that does not work, then your likelihood of moving to the second style of communication is where you have achieved the second highest score. So if I may explain, Dr. Ramya, in your case, you try assertion, which is very good. But in case if that does not work, then chances are that you will go into passive communication. And I'll explain all these styles in great detail. We'll go back with a lot of clarity. So, and if you see your scores are quite close by, 13 and 15 are quite close. So there's a possibility that you may choose any one of them alternatively also, depending upon the situation. So where you think assertion is not required, you may go into passive communication, especially like, for example, if you are dealing with people who are in higher positions or people who are aggressive, people who are in authority position. So with them, there's a possibility that you may go into passive communication rather than assertive. Dr. Dipti, if I go by your scores, 19, which is highest for assertion, that's very good. But if you look at 12, so you have got 12 for both passive and aggressive. Although it's not very close to assertion score, But then in case if you don't assert, then there's a possibility either you will become passive or there's a risk you will become passive aggressive. Your passive aggressive scores are less. That means something that you will do to sabotage somebody is less likely. Either you will be straight away, telling them whatever you want to say, or you will just withdraw from this situation. So do you agree with this course?
I think this speaks of my personality as a whole, not only patience.
So similarly,
I withdraw.
So Ritika, if I see your scores, see you are using passive and assertion, passive communication and assertion alternatively. Again, depending upon the situation, need of the hour, person with whom you are communicating, So Dr. Gaurav, in your case, your scores do not go with the kind of personality I normally see you as. So either you need to retake this test, or if you agree with this course, then I think I'll have to accept whatever scores you have mentioned. In your case, you are scoring highest on passive communication. And whereas passive aggressive and assertion scores are same in your case. Do you agree with your scores? Dr. Gaurav, could there be a confusion?
No, I missed the last 3-4 bits of it. I didn't know that you were addressing me.
Oh,
I'm so sorry. There was a glitch in my network. I rejoined back and I guess I missed it. I'm sorry. Could you repeat what?
Yeah. So if I look at your scores say that your dominant way of handling a disagreement is you will go into passive communication, or may alternatively use passive aggressive or assertion. Whereas whatever I have seen you in the program or in this session, I don't see you like a passive communicator or passive aggressive communicator. I've mostly seen you asserting with a lot of clarity. So if you agree with your scores, then maybe we really need to know more about you, or maybe you can retake the test to confirm whether the scores are the true depiction of you.
I think I'll retake the test, but
yeah,
basically, I'll retake the test. I don't know if it was biased or when I was biased when I gave the test, but I believe what you guys just saw was an impromptu version of what I am. So I will go with your thing and retake a test and get back to you with the score.
I suggest the same. So Dr. Ela and Dr. Namrata, in your case, your assertion scores are quite high, 19 and 20, which is quite good. And Dr. Ela, in your case, the next highest score is 12, which is aggressive. Though chances of you becoming aggressive are higher than being passive aggressive or passive, but then there's a huge gap between the two. But there's a possibility that in certain situations you would become aggressive. Do you agree with your scores? Okay. So I can't see Dr. Birender's score. Yes, I can see. Dr. Birender, I can't see your scores. Have you put in?
Yeah, so I had done the test, but I thought the results will go to you. So I didn't get those points, Anyway, you need to see those points, I suppose.
But I really wanted all of you to take this question and know your scores. You would really get to know a lot about yourself. I think, Pooja, you want to say something?
Ma'am, same thing like what Dr. Virender did. I did not note it down, just keep on filling it, and I was just seeing my Google if it will be reflecting on my screen also. So missed it.
Doctor, did you get our results? Did you get my scores? The form must have come to you, right? No.
I have the scores. I have the Excel sheet. I can draw it, but right now, if I take that Excel sheet, it will take us time.
Oh, fine.
So maybe I'll keep it for the next time. But I'll share your scores with all of you. I'll take out the Excel sheet and show everybody's score. I think Dr. Shashikala, even your scores I can't see.
I guess there's.
I thought at the end it will come, ma'am, everything together. Then
I had written in the instruction that please note down these scores in your notebook for further discussion.
Notebook means at the end it will come. I have to note down that.
No, Monica, I could not see. Yeah, Monica, I could not see your scores also. Have you taken the questionnaire?
Ma'am, I've taken the questionnaire, but same thing, ma'am. I could not jot down the scores. I was expecting that email response actually.
Oh. Okay, don't worry.
I did the questionnaire. I just came home and I rushed to join the program. In the last, I was late for 2-3 minutes, remember? So I just did the questionnaire that time.
Okay,
so I'm very honest, but I didn't get time to think much, So I've just responded. But
no problem. I have the scores with me. I'll share the Excel sheet with all of you. You can have a look at the Excel sheet. I'll share in the group. I
guess my scores were also skewed, ma'am, because both me and my sister, we took the test and we both jotted down our scores. I think while typing, I typed my sister's score and not mine. I really don't know what was mine.
Looking at your scores, I told you that they don't go by your personality. Either you have not taken the test or you have, or there is something wrong. I told you right clearly.
No, I have. I submitted the form what I sent. I guess scores would be with you.
It will be.
I'm really happy if you're there.
I'll share the Excel sheet in the group. Don't worry. I'll share it right away after this session. So quickly.
Actually, I took the test twice because first when I took, I didn't note down.
Okay.
And then I again saw, so I have again taken it today. Okay. About half an hour before this class. Okay. So that I have noted it down. So I don't know what response you must be having with your Excel.
So that's okay. You will get to see the consistency of your responses also. But I'll share the Excel sheet. We can always, that's the beauty of technology, It's so useful. It's so useful. Yeah. So not wasting much time, I really want you, to run you through a presentation which talks about assertion as a way of handling. Any difficult situation can be amicably held, well, if you know how to assert. A lot of time we think assertion is being adamant. Assertion is not being adamant. You can be soft and still assert. Just yesterday, I happened to see a beautiful documentary. The title of the documentary is RBG. I don't know the full name, but I know it's Ruth, who was one of the Supreme Court judges in USA. She passed away, I think, last year or last year at the age of 84. I saw her documentary. Her body stature is, I think, smaller than my, physique. You normally, I think, people who are tall and bold and broad, they have a more impact. She's such a small, structured lady, but such a beautiful, person to talk and to share her thoughts and express herself in the way she is assertive. One lesson that I learned from her was that when you want to make a point, never yell. When you yell and make a point, you lose the ground. So assertion, please remember, assertion is not raising the voice. Assertion is grounding your voice, making it so clear and audible that people stop and start listening to you, that, okay, you are saying something and that's making sense. So I'm quickly going to run you through this presentation. It might take 20-25 minutes from this session onwards. So timing will be between 2 hours and 2 hours 20 minutes because we need to cover the topic in depth. I don't want to be in a hurry. And after that, we will have presentation by Dr. Ela and Dr. Ramya. Is that okay for everyone? So quickly, I'm taking you to the presentation and simultaneously we will have discussion about the topic. Okay, so as I said, that there are different ways of handling a disagreement, and we have seen 4 different styles, and we have talked also a little bit about handling disagreement. So one of the ways that we all use to express or handle disagreement is passive communication. So what is passive communication? In passive communication, we normally take a quiet stand. If you saw the video that where I played the role of a passive communicator, you saw that I did not handle the situation. I did not try to deal with the situation. I rather took a escapist route, and I tried to avoid any kind of action on it. So in a way, you will be actually allowing your own rights to be violated. People can talk rude to you, people can misbehave with you, people can talk ill about you, but you just decide to be quiet. I'm talking about people who use passive communication as their prominent or dominant way of handling a situation. So they allow their rights to be violated, and they fail to express their honest feelings. Also, the goal of a passive communicator is to avoid conflict, no matter what. They do not care for the consequences, but they think, I don't want any conflict. So as a result, there's hardly any risk involved. It's the safest way of handling a situation, but then this is not the right way of doing, and this will also be non-productive way of handling a situation. So you will see people who would use passive communication as a regular way of handling situation. You will see them making very little eye contact with people around them, and especially with people who are in authority position. When they're talking, they'll be usually using very low and quiet tone. They'll be hardly audible. A lot of time you have to ask them to repeat what they are saying. They will actually fumble, but they'll speak in a very, very low volume, which is hardly audible. Often they will not share their honest opinion, and they will defer to others' opinion rather than sharing what they think or what they feel. So a lot of time you will see them using, statements like, I don't know, or whatever you think, I think you know more. I think you can decide about it. You have more experience than me. I think it's better if you decide. I'll go with whatever everybody says. I don't have any opinion. I'm okay with whatever everybody says. Or I don't care. It doesn't matter to me. So once in a while, if we are taking a stand like this, it's okay. But if it is my regular way of handling a situation, then it is not okay. Dr. Shashikala, you want to ask something or say something?
No.
I thought you wanted to make a point. So in certain situations, it is all right to use this as a way of handling a situation. Not that it is not helpful. There are situations when this kind of communication helps, especially when the result of pushing the issue would cause more problem than benefit. So for example, we normally say, pick your battles. You don't have to fight every battle. You don't have to argue with everybody. A lot of times people will come and say you something, you don't want to get into, that argument or discussion or unnecessary wastage of time and energy. So at that time, if you stay quiet, it's perfectly all right. There is nothing wrong in doing something like this. Or for example, when the issues are very minor, when it's not a big thing, there's not much to worry about, you can overlook that. Also, when there is a power differential that is not in your favor, that means the other party is agitated, aggressive, or is higher in hierarchy, and that the power differential is not in your favor. So it's better not to get into, a situation where conflict increases and you further damage yourself or, damage the situation. Even when you see the other person's position is impossible to change. For example, if you're dealing with a policeman and that he's not ready to budge, he's speaking on a point that you drove wrong or you jumped red light, you can pick that issue. You can argue, you can assert, you can go to court, you can also complain against him, but then you have to pick your battles. How much of time, energy, investment do you want to make? So in such situation, I think it's better to stay, passive and let the storm pass. Another way of handling disagreement, which is most common, I think, that we see across workplaces and even our personal life, is that's called passive aggressive. So in passive aggressive, the person apparently appears calm and quiet and okay and fine with everything, but internally the person is aggressive and unhappy and is always, kind of carrying resentment within oneself. So you will see people who use passive aggressive as a way of handling situation, they will forfeit their own rights initially, but then that will be followed by manipulation and vengeance. They will not let go. They'll talk ill about you. They'll blame you. They'll complain against you, but not on the face. They will not pick up the issue or discussion right on the face, but they'll mostly be, sabotaging you behind your back, or they'll be undermining your work or undermining your projects. The goal of this style of communication is also to avoid conflict, but also at the same time, they want to make the other party feel that I wish you had seen my way. I wish you had asked me. I wish you had given me a chance. So they want to always, push the other person into guilt or sorry state. A lot of time you'll see that these people would behave passively to people's face, but then aggressively when they are not around. So mostly they'll be talking and bitching behind the person. They often use sarcasm also to communicate their disagreement or resentment. These are a couple of examples that you will see people using in their way of handling situation. On the face they'll say, yeah, I'll do it, don't worry. Oh yes, I'll definitely come, I will be there, I will be the first one to be there. But then they'll say, oh, I'm sorry, I forgot. Or for example, in this case, yes, doctor, I will write it in the book. I'll write in the verbal order. But then later on they'll say, oh, I'm sorry, I forgot. Or they may also comment on people's attire or their dressing style or their hair and pass, nasty comments to make them feel, small. And also, if you look at the third example, I don't want to say anything. Otherwise, I could have shown him or her place. Usually all these things will be said in the absence of the person, because once the person is gone, they would talk ill at the back. Third way of handling a disagreement is active aggression, where people actually lose control. They become aggressive. When they talk, their language is inappropriate, their body language is inappropriate, facial expressions are full of anger and aggression. And this kind of style of handling conflict also we have seen, especially with people who have anger issues. People in authority position also sometimes I have seen using a lot of aggressive style with their subordinates or with their team members. So you will see that they will be protecting their high rights at any cost and at the cost of others, rights also. They would always believe I am right. I'm the one who would be deciding. I'm the one whose say would be final word. So they want to win at all costs and to be always right. They will not consider the consequences of their action. So sometimes people say, you may win an argument, but you may lose a friend. Similarly, they may win an argument, they may win a situation, but then the consequences, the penalty they pay later on, they probably don't consider while being in this situation. If you will look at their body language, especially their eye contact, will be usually very angry and intimidating. You will also see that they'll have a lot of energy, usually a lot of negative energy. They'll be either physically standing, or they'll be moving around, or they'll be, loud and belittling others. And they would never defer to others. They'll be controlling the whole argument or conversation. You will often see them using verbal abuse or violence in a way to express their anger or aggression. Some of the examples of aggressive communication are like, I don't know why you can't see that this is the best way to do it. You are really stupid. You don't understand anything. Or it's going to be my way or highway. You decide whether you want to be with me. So it's going to be my way. Or you are just stupid if you think that will work. You have no idea about how things work. Or I don't care what you feel. If somebody says, I don't think this is the right way, I don't care how you feel. We are talking about making things work here. So you have to just agree with whatever we all say. Or who gave you this license? Who gave you the permission to work here? Who appointed you? I mean, this is the way they would be, belittling others or humiliating others. So people who are using this kind of communication style, they need to really consider a couple of things. For example, if you're attacking your team members or your patients or people around you, for example, name calling or accusing them, that's going to shut down your productive communication with them. If it is your team or your subordinates, they're not going to be happy working with you. They're not going to give you their 100%. They will not align with you. They would not enjoy working with you. You will lose patience in case if you're an aggressive doctor Trust me, patients will not come back to you, because nobody likes to now, deal with an aggressive person. Or when you are tempted to attack, please consider whether you truly wish to lose the chance for a good relationship. A lot of time we lose the relationship just because of our aggressive way of handling a situation. Also, before you react, if you give yourself a minute, you will get good control over your temper, because when you are angry, it's your emotional mind that is riding the situation, and your rational mind is just parked on the side, or it's hijacked. So if you give yourself a moment, so normally we say when you're angry, take a glass of water, or maybe move away physically from that situation, or take a couple of deep breaths. So all that is a way to help you gain your calmness, so that your rational mind can start functioning and you can handle the situation in a more suitable manner. So I think the idea about handling your own aggressive way of handling situation is to work on your anger and aggression in advance, so that when you are in this situation, you can handle it more sensibly. Now, in a couple of situations, I think aggression is overlooked, and we tolerate people who are aggressive, especially when it is an emergency or a crisis situation. So in that situation, nobody will point out to your aggressive behavior, because they know that we want to get the work done. So I think it's okay to be angry. Also, when we know there's no time for discussion and explanation, so your ordering, your commanding, your shouting is also taken as a way to deal with this situation. And when you know that there's no place or no time to utilize your assertiveness skills, because assertiveness skills require talking, discussing, allowing the other person to speak. So that requires time. Also, when people feel that you are the only one who can save this situation, so in that situation, they will allow you to behave the way you like. But usually something like this is not taken well, especially on long-term basis. People do not like working with people who are aggressive. A recent experience, I don't know if I shared with all of you about that or not, is a very close acquaintance of mine. He got a very prestigious job in tier 1 firm. Did I share this experience with you? No. So after a lot of effort, he got a job in that prestigious firm, and within 2 or 3 weeks, he had this realization that this boss is horrible, very, very aggressive, very misbehaved. I mean, he would shout at his team and his staff in a very humiliating manner. So this boy, young boy who had gone into that firm with a lot of expectation, he was actually receiving wonderful salary, wonderful position. He decided to quit. So he spoke to me, he asked me, he said, I'm going to lose my mental health. And fortunately, he had his previous job still available, because they really wanted him to come back. And he got the good fortune of coming back. But otherwise, I mean, handling aggressive people can be very, very detrimental to people's health. I have dealt with a lot of people who have been, in the company of people who have aggressive temperament, and the person who is facing them actually loses their, mental peace and mental health. Dr. Ela, I think you want to ask something. Go ahead, please. You have raised your hand. Yeah.
No, I was wanting to share. This was when about the passive communication. Like today only, I had an incident in the hospital where we had to follow this passive communication. Otherwise, I am not the one who will follow passive communication. But the situation was so bad. The opposite party, the patient party, the 45-year-old male died, and the relatives were so aggressive, so aggressive. The reason being that they did not, hospital security did not allow us to see the patient, till the time he was alive. And now he's dead, and now you're telling us he's dead. So what we will do looking at him now? So the wife was very, very agitative, and behind that, all the brothers and brother-in-laws and everyone. So it was so aggressive, like the relative was in front of my eyes, and he was like, he will be giving me anytime, giving me a rap or something. But then I'm now realizing that I was just looking at his eyes and did not do anything. We did not say anything. We were just listening to you. All those relatives.
But I think one kappa from this situation, Dr. Ila, one kappa from this situation, corrective action and preventive action, is when the family says something like this, that you did not allow me to see my family member when he was alive, and now you are handing over the dead body to me. I think it's a huge learning if we can learn from this.
So that was not the whole truth, but then that was not the time to be defensive also at the same time.
Absolutely.
So we just had no option but to listen to them, whatever they were saying.
So you allowed them to vent. Wonderful.
Yeah, that's what.
Thank you
I
for
just
sharing
wanted to
this.
share that. Yeah.
So Pooja, you want to say something? I think you have a point to make. Go ahead. Pooja, we are not able to hear you. I think there's a huge network issue at your end. Your voice is... I'm really sorry. I think there's major network issue. I think it's better when the network is okay. Maybe then you can share your thoughts. Yeah. Okay. So as I said that I mean, aggression will not be, accepted other than these situations. And we really need to learn to work on our aggression. Otherwise, we lose our team members and people with whom we are working. So this is something that you will see a lot of time happening around you. People who are aggressive, you will see them using inappropriate anger and threat, even in non-aggressive situations. You will see them yelling and publicly degrading their team members or patients or their family members. You will see them intimidating their staff, their patients, and colleagues. They would be pushing and throwing objects, showing their tantrums, throwing instruments, throwing files. I mean, I'm sure you must have seen this happening, in certain situations. Then they will see them having outbursts of anger, physical abuse, and also, using foul language. People who use passive communication, they would usually be, chronically late. They will fail to return call. They will not respond, or their charts would be, their written work will be mostly inappropriate or inadequate. They will avoid meetings or discussion. Even when they come for the meeting, they'll stay non-participant. They'll be quiet, passive, submissive, not, taking any active participation. And they'll be usually ill-prepared or not prepared. And they'll just cut a sorry figure by saying, I'm sorry, I've not done this. People who are passive aggressive, you will see them usually hostile when they're especially writing about anybody or commenting upon somebody. If they get a chance, you will see them writing hostile notes. Even in the email, you can sense that passive aggression. I was never asked about it, so at the end now you're asking me to do this. I don't think I have time to work on it. I'm really sorry, I can't do it. So that's more like passive aggression. Or they may make a derogatory comment about the institution or the hospital or the individual or the department. You will also see them, using inappropriate joke or sexual harassment comments, or complaining and blaming others. So these are 3 different styles. I'm sure now you can relate and you can imagine who all falls into this category that you must be dealing with. And if any one of us uses these ways, often, we really need to introspect that, will this really work? And that means these 3 are not okay. There's another style that is more appropriate, and that's called assertion. So in assertion, you not only look after your needs, but you also respect the needs of others. So that's the beauty of assertion, where you are creating a win-win kind of a situation. So in assertive communication, you protect your rights without violating the rights of others. So I'll make sure that you are not disrespectful towards me, but I will also make sure that I will be respectful towards you throughout my conversation. The goal of assertive person is to communicate with respect, and also they would try to understand other person's point of view. So you don't go with the idea that I know it all and I am right, you are not right. So for example, if the family wants to go Lama and you think that it is not the right decision, you may be right, but you got to understand the other party's point of view and understand their concern and address those concerns. So through conversation, through discussion, you'll find a solution to the problem, and you will try to create a win-win kind of a situation. So you will see people who practice assertive communication, they'll make eye contact. I'll be talking about it a little bit, more in depth. So you will see them making eye contact. They will present their wishes clearly and respectfully. They'll be confident and strong and yet flexible. So you will not see them rigid. A lot of us think assertion is being firm on something or being rigid on something. No, rather assertion brings a lot of cognitive flexibility in us. So people who are assertive, they will be objective and they will not only state their thoughts and feelings clearly, but will also make an attempt to listen to others. And if they find the option given by the other person is acceptable, they would not hesitate agreeing. Okay, I think what you're saying is making more sense. Let's go by what you are saying. So they are not, being biased that I am right and I am the one who will be deciding, but they would rather listen to the other person and also, go by what is best option for all. So just to briefly, okay, let me first complete this and then I'll talk about it. So some of the examples of assertive communication are when they are talking, you will see them using, a lot of time this statement. So what you're saying is this. So that means they're making the other person repeat what they have said to confirm, am I understanding you right? So that's also giving a chance to the person to share their thoughts. They'll also see them, okay, I can see this is important to you and it is important to me also. So let's talk more respectfully and try to solve the problem. Or they will often use this term, I think, I feel, I believe. And also they will use more often we than I want this or I would appreciate it if you could tell me more about what you think. Also, let us see how we can find a suitable solution. So they will often use the term we rather than what I am saying or what I'm deciding. So, normally we think people are difficult and difficult to handle. It's actually not true. People are not difficult. They only seem difficult to the extent that we do not have the skill to deal with them, to what they bring to the table. It's our lack of knowledge that makes the situation difficult. So little bit, in-depth understanding of assertive, some of the tips that you can use, when you're asserting. I think the first one is objectivity. So whenever you are handling a difficult situation, when there's a conflict, there's a disagreement, there is some, a situation, it requires intense working, focus on the problem and not on the emotions. But people will bring a lot of emotions. They may be angry, they may be sad, they may be crying, they may be anxious. It's perfectly all right because they are overwhelmed. But you are handling the situation rather than focusing on the emotion. If you focus on the problem, you will be able to find a solution to the problem. But you can't say, I don't care whether you cry or shout. Let us talk about the problem. That's not the way. So using validation skill is a good way to handle others' emotions, where you can acknowledge their emotions but not indulge into it. So validation is in a way you acknowledge that, yes, I can see you're very upset, I can see you're very tired, I can see you're very disturbed, and from your perspective I can see why. So you are validating. Now let's see how I can make things better. Let's see how we can make this situation better. So now you are taking the person's attention to the solution. So the idea is that people's perspective are important, and especially when their emotions are not acknowledged, they are not, kind of validated. They feel that, oh, nobody is understanding my feeling. Especially like if even in your personal life, you may have seen when people come up with their problem or the family members come up with their problem, they want to be, pacified by saying, I can see you're very upset. You look very low. What is so? First, the emotional part needs to be validated, and not that you are agreeing to them being, upset. You're not saying, okay, you're being upset is all right, but you are saying, I can see you're very upset. I can see you're very frustrated. I can see you're very, sad. So that is like you're validating or you are acknowledging their state of emotional health. Next is when they start talking, usually it will look like as though they are criticizing what they are, saying. So for a minute, if you cannot look at it as a criticism, but as a feedback, you'll be able to deal with it in a more effective manner. So accepting their criticism as a feedback rather than an attack will help you stay calm and listen to them and understand their point of view. whatever they say, there will always be some element of truth. I think that needs to be acknowledged. In case if there is some error at our end and you can clearly see, you will have to acknowledge it to bring them to a point where they are ready to sit and talk and negotiate with you. If the criticism is not true, acknowledge the statement or the feeling expressed by them, state your opinion and provide them additional fact. For example, if an attendant comes and says, my mother is lying in the ICU for the last 1 week and there is nobody who's looking after the patient. Every time I go to the ICU, she's lying alone. There's no doctor, there's no nurse. I don't know how you're managing my mother. So you can see the family member's concern is about the patient's recovery and welfare. His or her concern is my patient being looked after well. But then this statement that nobody is looking after my mother and she's always lying, alone, is a wrong statement, where you can say, I can understand your concern about your mother. I understand. I mean, anybody in your position would be concerned about the recovery and health of the patient. But at the same time, let me remind you, we have put the patient in the ICU and the patient is constantly being monitored. We are monitoring all vital signs of the patient, and there's a way we can always look at the patient's internal state of health. And also there are set alarms in case if there's any deviation beyond a point, the alarm immediately rings and we would attend. And then when you say that there are nurses like 1:1 ratio in the ICU, or there are doctors 24/7 available, what you're doing is you're providing them facts and helping them see that what they're thinking is not completely 100% correct. So you're not arguing, but you're giving them facts to disagree. Another way of handling a disagreement is where you own. For example, if the person has a valid point about our behavior or our system failure or our mistake, I think it's time that we own that. Disowning will not help you. Being assertive does not mean that, no, I am right, I am always right, my system is beyond correction, my people are beyond correction. I think that's what hurts them more. So being assertive means you must own what is yours. For example, if your staff misbehaved or your staff did not talk to them properly, owning that is all right because you want to move further to find solution to the situation. A lot of time when they make false statement, or they give a false information, and you need to challenge it. So in that case, asking for evidence also will help. So when somebody says, all of you are useless, or all of you are unconcerned or insensitive. So when they say, and if I ask, you made this statement that all of us are insensitive, can you give me some evidence where you saw that we acted very insensitive towards you? So that means you are asking for evidence. So whenever people attack you with false or negative statements, do not lose your calm. Rather, ask for evidence and look for grain of truth. And if that is true, validate it. And then if you accept what they say, for example, if they say 10 things and out of 10 things, if 2 things are right, and you say, yes, you have mentioned all these things, I think these 2 things, I completely agree, you are right. This is where we have gone wrong. But I think rest of the things are not correct. You need to really check. And if you want, I can give you more information. This will break the barrier. This will actually bring down the wall. It will open door for further discussion, because they will understand, okay, you are agreeing to some part of the statement that they are making. Okay. So a lot of time when people, make some statements which is not true, or which is more like generalized kind of a, statement. So, and that's a very rigid kind of a, perspective. We don't have to always get into, argument to prove them that you are wrong and I'm right. So sometimes even saying like this, I'm really sorry, I simply don't see the way you see it, but you are more than entitled to your opinion. So that means I'm not getting into an argument. You're free to hold this opinion because that's your choice. So, and by providing factual information, you can afford to, you can try to agree with them. For example, if they say that you were listening, you were there, I saw you there, and if you say, actually, I was at work, so I couldn't have been there, it must have been somebody else. Maybe you're mistaking me for somebody. So that's with use of factual information, you can actually challenge the false information. So sometimes even pumping the negatives help. So what is pumping the negatives? Where you actually, when somebody is criticizing us for something, you ask for more negative feedback, but do it in an assertive manner. और बताइए, और बताइए, और बताइए, और क्या है, और क्या गलत है, और क्या क्या गलत है? No, not like this. So you said you're not happy with the services provided for the patients. Can you tell me what more can I add to my services to make my services better? So what you are trying to do, you're trying to get more ideas from them. So if you ask them, this hospital is useless, your room is useless, your bed is useless. So tell me more about what is bothering you about the room. What can I do to improve the services to your room? So you're asking actually in a manner where you're asking for solutions or more actions that they think that you can take to improve the services or solve the problem. That's another way of handling such situation. Persistence is another way. In persistence, actually the idea is that you stay focused on the issue. The family or the patient may try to talk about 100 things. अच्छा ये बताइए, अच्छा उस दिन ये हुआ था, अच्छा उस patient के साथ आप ऐसे कर रहे थे, आपको मैंने देखा उसके. So what they are trying to do, they are trying to distract you and put you on defense by alleging that the whole system is wrong, or you are wrong, or your team is wrong. You may say, I understand that there must be something that you want to talk about, but right now let's focus on this issue and resolve it. Because if you try to handle too many issues, you will not be able to resolve anything. So persisting on one issue at a time is another, way to handle it. And repeating the bottom line to keep the conversation on track. For example, when you say, I understand what you're saying, however, right now we are talking about this issue, so let's resolve it. Humor. How many of you use humor when you are dealing with the situation, tense situation? I want to ask you before we move further. Anybody who uses humor?
No, ma'am.
I know usually people do not advise using humor.
Not very frequently.
It can get very risky if the other person doesn't understand.
Absolutely, absolutely. But I have seen a couple of doctors using humor. Of course, as you said very rightly, it's very risky. It can backfire. It can actually, put things out of control. So you have to be very careful. So I remember one example of one of my husband's friend who is a surgeon. He's a bariatric surgeon, but he uses humor a lot of time with his patients, also because he has wonderful rapport with his patients. His patients really respect him, love him, and always trust that he is our well-wisher. So he uses a lot of humor. So I remember one day I had gone to meet him in his hospital. So and the usual practice, he would go to the OT and patients will be waiting in the OPD. So this is very often I've seen with a couple of surgeons, they will know that they'll be in the OT, but what they assume, okay, let everybody come. By the time I finish my OT, I'll finish my OPD and then, rush back. So that's how they have their way of functioning. But patients don't like waiting. We know earlier that was not the case. They would wait for hours and wait for the doctor. But today they say, whatever time you call me, you have to attend me at that time. So I remember once I'd gone to meet him and his wife, and he came out of the OT, and the one of the patient who was little more outspoken, he said, डॉक्टर साहब अगर आपको 2-3 घंटे OT में लगने थे तो हमें नहीं बुलाना चाहिए था ना, 3 घंटे हो गए मुझे आपकी वेट करते हुए. And he said in a very lighter way, आपको सिर्फ 3 घंटे मेरी वेट करते हुए, मुझे तो आपकी वेट करते हुए 30 साल हो गए. So there are people who use humor, but then it's very, very risky. One has to be really very careful when you are using humor. But what I would say, especially you can try it to start with in your personal life. I'll tell you my example, how I use humor in my relationship with my husband. So like most of the husbands and wives, we will have argument and discussion, and sometimes the whole discussion and argument becomes pointless and endless. to the point that we realize, why are we arguing? And we know it's such a rhetorical kind of a, discussion and argument we are having, and it's not going to get us anywhere. So what we have learned by chance is that when we realize that we are moving towards dead end and it's not ending, one of us would actually, crack a joke or say something like this. Like, for example, my husband will say, "Aaj aap bol rahe ho na, aapki bari hai. Next will be my turn." We will immediately know that this is a kind of a stop loss button. It's like the other person will immediately laugh. So if you want, you can try using it. Humor is a good way, but it's very, very, difficult and risky. But people use humor to sometimes break the, negative environment or negative emotions. So it can put tense situations at ease. So when there is a grain of truth, even if you joke and accept it and own it, that is also, oh, how stupid of me. I can also make mistakes sometimes. I can also look. So you are kind of sometimes even making fun of yourself. That also helps in, making other persons feel, oh, she's accepting her mistake or he's accepting his mistake. So, but you have to be really careful when you're using, humor. So while asserting, these are a couple of, examples I'm sharing with you. When you're asserting, normally what we say, instead of that, if we said something like this, I think it will make more sense. So when we have a tendency to give general statements like this, you never let me complete. Instead, if you say, can you please allow me to complete? It will have more impact. You didn't give me the instructions on time. Instead, if you say, I'm really getting delayed in making the plan of work, since I don't have the clear instructions now, can you send them as early as possible? Or I feel frustrated during meetings because I don't get to present my work. I would like to do a complete presentation so that I could provide valuable inputs. Instead of this, no, I'm sorry, I think yeah. So you don't let me present my work during meetings. So sometimes, with juniors and seniors, this kind of conversation we get to see. Instead of that, if you say, I feel frustrated during meetings with you because I don't get to present my work. I would like to do a complete presentation so that I could provide valuable input. So you're being more clear with your expression and what you want. Working in this place is impossible. None of the issues are handled properly and the whole place is falling apart. So again, I'm making a general statement, negative statement. Instead, if I say, I find it really difficult working here. I think something needs to be done about the way we handle important issues. I'm worried about the future of the organization. So you are being more specific about what you want to say. So the benefits of assertive, before that, I think I just want to quickly share, a couple of tips that you can start using right from today onwards. See, when you assert, there are a couple of things that you have to keep an eye on. The first one is your language. So when you're asserting, be it with your family members, with your spouse, kids, brother, sister, or at a professional setup with your colleagues or your patient, please make sure that your language is respectful towards the person. Never go down with the level. That's very important. Even if you're dealing with the younger person or subordinate, a lot of time we go down to the level of saying tu and tum. Trust me, they will not take a minute to use the same language against you. It's a downhill kind of a situation. So never use foul language. No derogatory language. Always respectful. Up. One thing. Second thing is your paralanguage. So in paralanguage, tone of voice. So your tone of voice should be friendly but firm. When I say friendly, it should not be intimidating or showing authority or showing anger or aggression. But it has to be firm, because when you are asserting, you are making a point and you want the other person to consider that point. So anytime if I'm saying, please try to see my point of view, you really need to understand what I'm saying. That is not going to work. I'm ready to understand your point of view, but you have to listen to me also. Please allow me to complete. I have heard you. but I need to also tell what I think about this. So I'm using the right language, respectful language, but my tone of voice clearly says, I mean it. You got to listen. Then the speed of speaking. Normally, the moment we become aggressive, the speed of speaking becomes fast. Very consciously, very mindfully, you have to make sure that your speed of speaking is either normal, natural, the one which you are using regularly. You could even slow down a bit. That will help you making more impact in this situation. Volume. Again, usually when we are angry, the volume goes up. And we think speaking loud means asserting. No. Never raise the volume. Never raise your voice. If your volume is either same or maybe slightly lower than normal, even that will have a huge impact. When you are asserting, so I've talked about the tone of voice, volume, speed of talk. When you are asserting, I'm talking about the body language part now. Make eye contact with the person. Always make eye contact with the person with whom you are talking. Second, sit and talk. Eye to eye level. What happens? For example, a patient's family has come to your room. You're sitting in your office on your chair. The person is standing. Now I'm sitting and the person is standing. I have to literally bend this way to talk to the person. And if this discussion and argument goes on for a good 10 minutes, that's going to strain my neck. That's going to add to my irritability. And that will also, be visible in my tone of voice and my way of handling situation. So if you are sitting, make the person sit down. Yes, I completely agree with you, Dr. Birinder. Especially when you make the person sit and talk, half the anger goes down. And there's a scientific reason for it. To fight, you need to stand. To fight, you need more energy. When you sit down, your energy goes down. Absolutely. Offer water. Even asking, पानी लेंगे आप? चाय लेंगे? कोई बात नहीं, आपकी प्रॉब्लम सॉल्व करूंगी, मैं इसलिए बैठी हूं यहाँ पे, मेरा काम ही यही है, आई एम यूजिंग ह्यूमर, मेरा काम ही यही है, मेरी ड्यूटी में मुझे सैलरी इस बात की मिलती है कि मुझे आपकी तकलीफ सुननी है और उसका सोल्यूशन निकालना है। चाय तो पी सकते हैं, चाय पीने में तो कोई वो नहीं है, आपकी नाराजगी को हैंडल मेरे करना मेरी, सो आई एम ट्राइंग टू काम द पर्सन डाउन. But when I'm talking about an issue, there my body language and my facial expression should show seriousness. I can't be pleading. I can't be scared. I can't be saying, देखिए मेरी भी तो नौकरी है यहाँ पे. No, I can't be talking like this. No. So sit and talk. Very right. I agree with you. If the other person is not willing to sit and talk, I would advise even you get up. Stand. It's okay. अच्छा आप नहीं बैठना. कई बार ऐसा होगा. नहीं मैं नहीं बैठूंगा. कोई बात नहीं. चलो मैं खड़ा हो जाऊँ. क्या फर्क पड़ता है? आराम से बात करते हैं. Stand up. Of course, if you think the person is aggressive and can become physically sick, maintain safe distance, but then stand and talk. So it has to be, your body language again plays very big role. If you're keeping your hands like this, and if you're sitting like this, all this indicates that I'm closed or I'm authoritative. So in assertion, if you're leaning forward and if you're slightly, putting your hands on the table, going closer to the person, that's an indication that I want to get into a dialogue. I want to find a solution working with. So if you can look after these things, first is your language. Do not go down to derogatory or disrespectful language. Tone of voice, that is paralanguage. Tone of voice, volume, and speed of talking. In body language, most important is eye contact. Facial expressions. So facial expressions have to be firm but friendly, not like rude and authoritative and with big eyes. Sit and talk. Let it be a dialogue. ask them first, what is your concern? I think if you allow the person to speak, a lot of anger gets diffused just by listening to the person's concern. Sometimes the issue is so small that you can actually handle it and, get rid of the situation. So it's not always required to, have an argument around it. You can, and this has to be the regular way of dealing with situations. So the benefits of assertion, if you are using assertion as a way of talking to people, I think one is there is no accumulated anger. For example, if I have a disagreement with you on one point, I talk to you, you tell me your point of view, I tell my point of view, and never go with the idea that what I'm saying is the only way and the right way. There's a possibility when you will listen to the other person's perspective, they may be very right from their point of view. And you may even happily accept it. It's all right, I agree with you. If, for example, the patient's attendant was arguing with the security guard, then with the nurse and with the resident to allow the one of the attendant to go and see, and they were not allowing because timing nahi hai, and the issue comes to you as an administrator, and it's not a very big thing. And if the family says this patient's attendant has come from foreign or from a different place and wants to see the patient for 5 minutes, and if you think it's not a very big deal, it's all right. See, we normally don't allow, but I'm making an exception in your case. But I would request you not to repeat it in future. And you can end it. So, I mean, you can pick your battles how you want. So there is no accumulated anger if you are, practicing assertion on daily basis. And it's not just dealing with conflicting situation. I think assertion has to be the primary way of interacting with people. Then, of course, it will improve your relationship with people. When you speak openly and honestly, and when you listen to others, people will come out with their thoughts and feelings more often. Then also, people will take your opinion seriously. They will listen to you because you are always respectful. You lend them an ear. You understand their point of view. So they will actually respect you for your, and they'll respect your opinion. As a result, you will definitely earn more respect and credibility in your system. And people whom you respect, I think you must be seeing this very often as their way of handling situations. You can see in your life among your relatives or friends or workplace people whom you really admire. I think this is one quality you will see in them. And then also there's a reduced risk of aggression or violence or exploitation. So to summarize, I think we all have a primary way of handling a situation. Similarly, you will have people who would come with their primary way of handling a situation. So observe yours, work on yourself, move towards assertion in as many situations as possible. And also, even if they are acting aggressive, you can calm them down by using assertion as a way of handling the situation. So this is about assertion. And I think this is one skill I really wish that we all learn as much as possible, practice, implement, and it's very gratifying. Not that always what you say will be heard or agreed or will be followed, but you will be happy that at least you could speak your mind. You could say what you wanted to say. Any questions about this? About what we have discussed till now?
Dr. Endu, at times we see scenarios in my clinical practice only. Suppose I'll give you the real example. I operate upon a patient of endometrial uterine cancer. And I know this is an advanced stage and she should be having a chemotherapy after that. Otherwise, whatever good work we do, that won't be fully beneficial. But the family, you can say, is not really caring of whatever issues they have. They refuse chemotherapy order. हम अभी नहीं करा सकते. अभी नहीं करते, अभी तो बस अब छुट्टी कर दीजिए बस. And I struggled a lot, me, my co-consultants. It is very important that she gets timely chemotherapy. Doctor, operation तो हो गया ना, हम करा लेंगे. So that becomes very frustrating. एक वो जब patient sick है, and you know that this old lady needs care, but the family is not caring. and I can just see it. Suppose a cancer cervix, an old lady, nobody coming to care. I want to keep her, I want to care, but then my system requires some support from the family. I can't adopt the patient. And they just say, "Aap bas chutti kar dijiye, doctor sahab." So at that time, it becomes difficult how to make them understand and how to make them do things which you feel is vital and which is doable.
So very quickly, I think 2-3 things that I can suggest you is, one is we have to draw a line up to what we can push. We have to be clear about this. Second, we have to put the ball in their court rather than we pushing them to agree to something. Because when you say something that needs to be done, it appears as though I want this to be done. Third, identify the primary caretaker who are really the well-wishers. Connect with them and talk to them one-on-one. And whatever statements you want to make, convert them into questions. Dr. Eli is going to talk about it in a while. Ask them, do you want full recovery? Do you think this is enough? And also,
now I'll tell you the second part of it. Why this? I just received a message, and it was from the same patient which I operated a couple of months back, and at that time she refused, and we were very frustrated. The husband contacted my team members today afternoon and said that he's going to come for chemotherapy, and the residents have got her registered. So, I mean, on this a little satisfying note, that
had you not explained, they would not have understood. See, they don't know the importance of or the relevance of chemotherapy and surgery as a total treatment for the recovery.
I myself counseled. There was only one caregiver, the husband, and she happened to be second. Whatever the dynamic, at times they don't come up with the family dynamics also, or whatever the reason. But the good note is, since I just received the message, so I shared that this patient was not willing, but 2 months down the line, the husband is bringing her back for chemotherapy.
And
so, but at that time, it's frustrating.
Yeah. So, Dr. A lot of time, their concerns are very genuine.
I understand. I mean,
their situations are really beyond their control, and they also are very helpless. So, there maybe creatively you can find what is the other way out to help the patient. Maybe, like, for example, if a patient has come from a far off place, asking them to do the follow-up at another place, or maybe coming to you not that regularly, but after a gap, they can come back to you, or telephonically they can connect with you, or there's a way to, do a follow-up, or you could even liaison between, other resources and the patient. So very creatively, you have to find solutions for such situation. But a lot of times their problems are very genuine. Their concerns are very genuine. But again, you do your best, give your best, and then let them take a call what they want to do. Our responsibility ends when we have given them complete information in a compassionate manner, helping them see that you want to help. That's all. Beyond that, you can't, you have to draw a line here. And there is no need to even get angry. And even when they come back, there's no need to even lash back. But I told you, you did not listen to me. Ab situation kharab hogi, ab aap lekar aaye. I can say the same thing. देखिए मैंने आपको तब भी समझाया था, और अब आप जब लेकर आए तो अब हालात और भी ज़्यादा खराब.
I think my team with your coaching is now geared to say it's good you have come back. We are glad you have come back.
Absolutely.
So I'm sure none of our members will say that it is bad. We all say I'm happy that you have come back. You have listened. Take a bite.
See, they are responsible for their action. I am responsible for my behavior. If I shout at them before I hurt them, I'm going to hurt myself. So this is a very mindful process. And I don't have to become aggressive or angry with it. That's something I really need to, be mindful of. And if we know that when we are talking to the patient or with their family member, we are concerned and compassionate, it gets seen by them. They are able to sense it. From your body language, from your tone of voice, from the words, they get an idea that you are being nice to them. That cannot get ignored by them. That gets noticed. Okay, any more questions? I know it's been a long presentation and discussion, and this topic needed detailed, working. Any more questions about it?
Like there may be people, like we as an individual have our own nature, the way we handle with our people, and maybe at hospital we are more in a better way sometimes to please the crowd, but sometimes we don't apply same at home. Sometimes we are different. All these theories, we take it for granted. So as a healthcare professional, whatever we have already, maybe you call it as a burnout or anything, at the end of the session, we would like to know that what are the must thing one person remember as a communication goals, either it is at home or at workplace. So sometimes we may not sound very bad at work, but the same doesn't apply at home. That why it comes.
So true. I think very clearly said that we all have two faces. One at the workplace there, because we are in a social setup, we know people are observing, people are judging, and my performance has an impact on my social image. So there we are more guarded. But in personal life, we at times become very, sometimes not only carefree, but careless. We don't
Irresponsible.
and we don't respect the values, we don't respect the relationships, we don't value the contribution of our family members to our life and whatever they're doing. But I think the moment you will become conscious of this, and more close these two images are, your social image and your personal image, more comfortable you will be. It's a journey. It's a journey. Sooner you start this journey, better it will be, because ultimately we are one. People say, can I request you to mute your device? Somebody's okay. So see, ultimately, like I see people saying that you got to be really nice at workplace and you don't have to bring your personal life to your workplace, or your work stress should not come to your personal life. I feel that's not true. We are one human being. I don't have a button that I can put off and on at different places. So as a human being, if I can make myself better to deal with these situations and be more myself everywhere. So rather than showing a false image in a public place and showing a different image at a personal front, if I can have one image that can work at both the places, I'll be more comfortable in my skin. But it's a journey. That's actually what is the purpose of being on this earth, I would say. That's spirituality.
Yeah, especially the profession actually affects your personality. Maybe we are different. And when you're in the army, you would have always acted tough and all. You come back and especially with the kids, I feel. I have a 20.
But I think they are the closest ones. See, our spouses and our kids are the one who are our support system, who are our roots.
And we tend to take on them, and especially I have 24-year-old. Sometimes I feel I don't follow all this with him, and when you communicate,
this is the first stage of learning, Dr. Shashikala. This is the first stage of learning. Unconscious incompetence to conscious incompetence. So you have already started your journey. The next step is competence, where you are supposed to be nice to them.
We throw all judgments, everything on the kids. Like if you consider a patient is so important to you, you are so good there. And I find very different personality when we deal. Maybe it is a different topic, but communication is same. I feel I'm the same person. I am affected by it. And
but more closer you will bring these two things, more easy it will be for you to maneuver. You will not have to wear a mask and remove a mask, because you are in your natural.
It's so annoying in front of the kid. He's not a kid also. Like individual with 24, you need to give a lot of respect when you're talking and all.
Absolutely. But in general, if my approach is to be respectful to others and their space and their place, I think that will become part of your persona. That's the final stage of learning.
I do it with others, but I'm saying this I don't know. I have to patch it. Yeah.
Most of us do not admit, but I think I'm glad that you're admitting. But if there's a realization, there will definitely be different change. There will be improvement. I can assure you this. Thank you. So friends, I think we are already past 30 minutes. can we quickly have these two presentations, because Dr. Shashikala's presentation is still pending. So can we quickly have, if you all permit, whatever everybody says. I know we have gone much beyond the time. Credit goes to all of you, because all of you have a lot of points to share and discuss and share you. But then at the same time, that takes away a lot of time, to cover a topic. Whatever you say. Dr. Virender, what do you say?
That's the most assertive way of communication.
I'll go by consensus. If everybody agrees, we will continue. And maybe 10 minutes of presentation.
Okay.
Or if you want a 10 minutes break, eat something and come back, even that's acceptable to me. No?
I guess continue, ma'am. Like,
okay. Anybody who is not okay, raise your hand, please. I think that's a better way. Anybody? First of all, I can't see everybody on the screen. I can see only 8 of us. There are 3 more members. Okay, Banu Rekha, I know she said she will not be. Monica, you are okay? Okay. Namrata, are you okay? Wonderful. Thank you. Dr. Ila, I'm giving you the rights to share your screen, and you can start with your, after you, Ramya, will do the presentation. Thank you.
Okay. Yeah. So great. Thank you. Thank you for the opportunity. I know everyone is tired, but still we will have the presentation. So before we start, I have some questions for all of us. We had many discussions today for our many case scenarios. So let's understand how it works. I have to go on the right side. No?
Yeah, you have to.
Where do I share? Okay, share screen.
Yeah.
Yeah, is that visible now?
Yeah, I think you are able to. Yes. Yeah.
Okay. So I want to start my presentation by asking some questions.
So Dr. Ila, can you start with the slideshow?
Yes, sure.
Yeah. Yes. Thank you.
Yeah. So I want all of you to answer in chat box, if workable for all of us, and if this answers in the form of yes or no, and if you're following it most of the time, then say yes, or you may say no then later. So do I greet the patients? You can write like that, 1 yes or 1 no, whatever. Do I address the patient by name? I don't know. 1 minute. Okay. So do I introduce myself to the patient? Do I have good eye contact? Do I offer a seat and show the patient to sit? Do I begin the conversation in an informal way to build the rapport? Or do I allow the patient to narrate his problems? Okay. So many of us are having the answers in the form of yes. Do I listen to the patient problems attentively? Do I listen to them patiently? Or do I use the empathizing expressions like I can understand or how upset you are? We spoke about this today. So thank you so much for answering. So these questions are, what are these questions? 1 minute, my slide is not moving. Okay, what are these questions? What do you think? Anyone wants to answer? I mean, when we read these questions and when you were answering, what came to your mind? What were you thinking?
Introspection. Like
perfect. Self-evaluation. Dr. Ramya has told us introspection. Great. So so these questions are actually called as, I don't know how. 1 minute. The slide is not moving. Okay, yeah. So these are called as reflective questions, and that is the topic for discussion for me today. So what are reflective questions? As Dr. Gaurang said, these are the questions. This is a powerful tool and a pedagogy. We can use it in many of the situations, and where while dealing with people, which helps people to reflect upon and self-introspect. So that makes them think, that makes them answer, makes them self-introspect, self-realization basically. So we can call it those questions that makes us look back over what and how I have learned this thing. This is the skills which I've learned, otherwise known as thinking about how we think and learn. This is this is how I have learned. So let me just say, how do we use this pedagogy? Okay, so how do we use this pedagogy? Even if now we understood what is reflective questions. So how do we use this? It's like whenever we want people to introspect what? In the form of their thoughts, beliefs, feelings or behaviors, our attitude, value system, belief. Basically, this is all introspecting myself, my own feelings, behavior, my attitude. When those type of questions are put up to me, I will go into that mode. I will re-examine myself. I will ask questions so that I don't confront with the opposite person. I don't put a judgmental idea, but at the same time, I give an opportunity to another person in front for re-examination of his own thought process. It is like some of the examples which I have written here, but also, of course, today we discussed so many examples. Like I would rather, I've written here example, but then the first role play which we did, Dr. Gaurang did, and with the Ritika and Dr. Ramya, it was such a fantastic thing where, Dr. Gaurang could have said, okay, what works for you? What are you worried about? What bothers you? These are some of the questions which make people think exactly, and they come down with a lot of thought process, and they come down to some particular thing which they want to talk about. So this right question at the right time, appropriately, when we ask them, do you think it's a right approach? Like when I have written here an example, patient is asking for the water in the post-op ward, where doctor has written NBM, and nurse is not able to provide the water when patient is asking. So she will be adamant to say that no, doctor has written the order NBM and I cannot give the water. So, but then the complaint comes to the management and administration. The nurse is not behaving properly. She did not follow me. She did not give me even water to drink. So many things comes up. So, like dealing with nurse, you can't directly say why you did not give water. There has to be a mechanism. There has to be a way by which we can make them think. What exactly do you think this was a right, appropriate approach? This is some of the questions which make the nurse also think that yes, if I would be given an opportunity, I would like to behave or do it differently, something like that. So these are the reflective questions. Where do you think that we can use this pedagogy? So again, basically, when we want a change in the behavior, a modification, an introspection to inspire people, to motivate from the routine work, we want them to now change so that their routine pattern of behavior, which they are just following, and there is no change in the attitude. So when that is the time we use this, re-examining your beliefs and thought process. I have written here because I am facing these issues in my hospital, like consultant not following the process of documentation, where sign, name, date, time, SNDT. For them it is what a big deal, if we forget like that. But then I can't tell them directly that why are you not writing, what happens, what makes you not write this. So the question is, what do you think? Does this really takes a lot of time of yours to write SNDT? Is it the only need of NABH, or is it our personal need too? So this question makes them think that if I'm writing SNDT, it is for my own need, it is for my own good. It is not only the good for the hospital or a patient, but for myself. So this is how we make them think. So these are a couple of examples which I have written here. So advantages while using this reflective question pedagogy is it, like, I don't know, many of the things you have understood, but still I would like to mention is that it will bring my own self-awareness. It will, when I increase my self-awareness, I will develop my own emotional intelligence. It will increase my emotional intelligence. I would understand the others' perspective, basically. It is not only my own perspective, my own behavior, my own attitude. I will start thinking from the other's point of view. I will start reflecting from that angle. It will help me to think creatively. How can I do it this in a better way? I will, if I intention about it, then it will work. So I will start thinking creatively. It will help me to increase my intention. Encourages the active engagement in the work process. There is no judgment, there is no confrontation. While aligning with the person, we are not here finding the faults by asking questions. It is just a simple question which makes them think. We are not finding faults with them. Person becomes more open-minded, and basically we are changing the mindset from content to the thinking level. It works at the context level. That's how it works. So of course, there will be some disadvantages if we don't know where to use this question, with whom to use this question, how to, then there can be, people may get put off. They may not like the way, they may not appreciate, they just, because like with some senior people, you can't just ask, you have to have there will be of course, we will discuss about do's and don'ts, but we have to use it very carefully also. We need to be prepared, actually. You can't just ask the way it comes to your mind. That is what I'm trying to say. Maybe sometimes time consuming, and people may find it challenging also, because it is going to challenge their old thought process, their old pattern of behavior, whatever they've been going through till now. So there will be do's and don'ts. So do you want to answer? Does anybody want to say something in the chat box? What do you think? Do's and don'ts of this. Do's and don'ts of this pedagogy. Can anyone share, or you want me to go ahead? When can we? What should be the do's and what should not be? We should be taking care of. So basically, okay, if that is the case, don't point or direct the questions to the people. Yes, that's true. So we have to be, mindful. Before we put up the questions to somebody, we have to have a rapport with that person. Like today also in the class we discussed, unless I have a rapport with somebody, that because the question becomes then part of this assertive communication. Yeah. I feel that, So if I have a rapport with somebody in front, then only this question will work in the right manner. So developing rapport becomes must before we question someone. Shall be done on one-on-one. And of course, when we want to talk to somebody individually, one-on-one, we talk in a separate room, in a counseling room, in a group discussion when we do for sensitizing people in a group, and need to start with superficial. So building a rapport, when it becomes a part of the process, we can consider, there are type of question basically. So there are some superficial questions, when after asking superficial question, we go deeper. So that's how, so I just want to explain this a little more, that how the superficial question, like as the last time the question, last time the pedagogy was, this was ice-breaking activity which Namrata did, where, making fun and creating some fun process. So that is of building a rapport. So by asking superficial questions, basically we are building the rapport in the form of questions. So that is what it says. So what I have learned something new, which I want to share with all of you, is that there are called as green, blue, and purple questions. So these are green questions are the most superficial, blue are little more deeper, which make you think before you answer, and purple is the most deepest. Where you have to actually work on, think about your belief and what have you been presenting yourself till now. So that is how these are this type of questions. Developing rapport in a group discussion. So when we, these are the questions, I would like to give an example. We can use it while developing a rapport in a group discussion. We want to start a presentation, for alignment with the audience. So these are the questions. What is the strangest food you have ever tried? So this is something which is a fun-making question, some superficial question people won't mind answering, So even if I don't have rapport, I can build up the rapport by asking this type. So this is type of the reflective questions. My point here is, so that I will think, maybe I'll think, or I just have what's there in my mind on the top of my mind and I'll answer. What is one of the favorite topics of conversation? So people would like to talk about it and they'll open up very easily. Then we go a little deep in the form of blue questions. So what is an idea you strongly believe in? So I go to little more deep on the belief level. What are you grateful for? So this is again, I will talk about my value system and beliefs. Now we are going a little more deep. How would you like to be remembered? So this is what now my value system, my core values of my life, which will come across when I want to answer this question. What is something that I do differently than most of the people? Or what is difficult for you now, but that was easy at the child? So this is the way green, blue and purple question makes sense. So finally, where we use this reflective question as a powerful tool for coaching, it is a fantastic tool, making someone think in alignment with your thoughts. Basically, what you are thinking, you want somebody else to think in your line, in alignment with you. So that is the time we can use this question and we can help them to think in our line. Developing the rapport, challenging people's thoughts. That is where, without confrontation, without judging them, we can use this pedagogy and help them to think on their own, challenge their own thoughts. It is tool to mold the behaviors of the people. So this is what about reflective questioning. Thank you so much. Thank you.
Thank you, Dr.
I hope it made sense to all of you.
Definitely.
How do I stop?
Yeah.
Stop. Okay.
Yeah.
Thank you. If anybody has any question, we can discuss.
Thank you. I think, yes, Dr. You want to ask?
Some of the questions appeared like the icebreakers that we had.
Yeah, exactly. So that's what I shared. No, the green questions, which were superficial questions, the most we start with that. So these are reflective questions, which works as an icebreaker when you start a conversation in a group, where you want to, start get alignment with the audience, where you want to build up the rapport. So that is where we can use this. So these are some of the way by which we can use different questions at different times.
So basically, the idea of reflective questioning is when you don't want to tell the person you are right or wrong. So you are not judging, but you want the person to re-examine their behavior, their thoughts, or their feelings, or their beliefs. So basically, by asking in a very neutral way, if you're asking a question, do you think this was done in the right manner? So you are not saying it was done right or wrong. So what other ways could you have dealt with it? So what you are doing is you are helping the person think of possible ways to deal with that situation. Especially with adults, you can't go away just by saying right or wrong. So you can, that's what I said, that when your patient's family wants to take the patient home and not complete the treatment, and if you ask them some reflective questions like, do you think the treatment is over? Do you think that's the end of treatment? Do you think with this the patient will be able to live a healthy life? Do you think that's enough? Is there any other way to help the patient? So what you are doing, you are asking the same thing that you want to say, you are garbing it into the form of a question, but in a very non-judgmental, non-confrontational manner, you are asking that question, helping the person start introspecting. That's the idea. That's the idea about reflective questioning. So a lot of time when you want people to consider your point of view, it will say, okay, communication skills are very important. Instead of that, you ask, what challenges do you experience communicating with people? Are you able to handle difficult situations? Suppose if I ask you to break a bad news to the patient's family, can you do it? So what you're doing, you are making them reflect on their ability. Most likely they'll come up with it, no, I can't do it, I need to understand. So this, to introduce a topic, you can use reflective questioning as in the beginning. Yeah. Dr. Dipti, anything you want to further ask?
Yes, I just want to share, like, without knowing that this is a reflective thing, and I think I exercised it today only, because after this baby died, so I had a word with neonatologist, and the neonatologist said that, ma'am, for past couple of months, we are seeing many more early neonatal sepsis than we used to see. And I asked him, okay, what do you think? What's the reason? And one thing he said is, ma'am, go and look back at your labor room. What's happening there? I mean, why early onset sepsis? So from there, I traveled to my labor room with my team, my co-consultants. And then I went to the sister's room and I had called all of them I said, I want to chat with you 5-10 minutes. And then I asked that this is what is happening. And the neonatology team feels that we are not doing everything all right in laboring. So what are your thoughts about it? So I thought that I use this reflective questioning as a part of risk management too.
Absolutely.
Not only with the patient, but with the colleagues to do risk management. So I think this will be a very good tool in risk management and adverse event analysis when we are dealing with our co-workers.
Absolutely. Absolutely. That's the point, that reflective questioning should be actually the approach of coaching, mentoring, teaching, counseling. In all, even in counseling, we use this as an approach. Rather than providing an answer, we ask this in the form of a question. Person has the answer. It will come out. But when it comes from within, person is more receptive to it and opens up. Thank you for giving that example. Thank you. Thank you. So if there are no more questions, can we request Dr. Ramya to quickly do her presentation? We are not able to hear you. I think there's again some challenge at your end about this.
To hear me?
Yeah, that's better.
Okay.
Yeah.
Yeah. So I would like to start my presentation. Like all of us would have studied in colleges, schools, and all. And but very specifically, we would like to have one teacher as our favorite, isn't it? Yes. So what was her quality which attracted you towards her? Can you just put in the chat box? You can also comment on her way of teaching as well. Everybody teaches, but some teachers are very good teachers. So you like that? Yes, I got 3 responses from Ritika. Kindness, Namrata, very interactive. Dr. Monica says she likes her dressing. And Shashikala is inspired by the smile. Yes. Banu, can you just put your response? People are still thinking, it seems, huh? So you don't like any more teachers, is it? Dr. Ila, what about you? You have not typed anything.
I responded. It's the decent way of speaking and the knowledge of the teacher.
Okay, not able to see your comment on my chat box. Okay, great. Fine. So way of teaching. Yes. So I used to like my English teacher because she used to be very fat. So you can't say she is very good to see and all, but the way she will take you from the story and how she will be telling, we will be just traveling with her in the stories, and I can even see those things which are going around when I study the same story again with my son and daughter. So that has inspired me. So that means the interesting way a teacher is making you to come along with her and enjoy the lecture, isn't it? So the way she introduces the things and the way she tries to make you not even to have a blink, and you just wanted to have the story along with her, and you don't want the period to even to come to an end. You want to finish the story and then go ahead. So if that sort of thing can be created, so a learner will never forget that things, right? So in my first year, the fundamentals of nursing was used to be the subject, and where they will demonstrate you each and everything, how to take a temperature, how to take a blood pressure, and the teacher will touch your hands and she will make you feel the pulse and all. So that time it was very much necessary, and till now we are able to do the same, and we cannot forget the touch as well. So let's continue with that. How interestingly you can make the lecture go ahead. So for that, I would like to share a video and you have to guess the topic of that lecture. So yes, so what did you see in that picture and what was the topic which I would have selected for the group?
It's about
Okay,
teamwork.
storytelling. Shashika, you can just unmute yourself if you want to say something. I am not able to hear you.
No, I said storytelling is mine, so that is obviously not.
No, tell me the topic. You have seen the video, and what is the moral of that story, or what is the thing which you will take it?
Together we can
United we
achieve.
stand,
It's teamwork.
divided we fall.
Yes. So Namrata has picked up the topic just same, that is teamwork. So without a team, you cannot work together, and many times a team helps you to get over the problems and get more opportunities and to stay together, to gel together. So here I would like to also share with you some very interesting fact which I have learned during this research of doing this topic. Can you all see my screen?
Yes, we can see.
Yes, ma'am.
Yeah. So interesting facts about teamwork is the ideal team size is 5. If you have a team size of 5, that works very well for you. Second one, the most effective team does not have any leader. There is a horizontal relationship. There is no vertical relationship. And third one is mixed age team outshines a youth team. So if you have a people only 16 or 18 years old, or you have another group where you have a variety of people coming in, so that team will work and outshine more than the young people. So these are some of the interesting facts of the teamwork. So you would have identified what was my topic, or I was actually trying to introduce a topic in an interesting way. So I have picked up video as an instructional mode to introduce one topic, right? So if you see a video, what could be the advantages? Can you put in the chat box? If video is a part of the media which has been used to introduce a topic very interestingly, so what would be the yes, engaging more, engages the learner, visualization, yes. Dr. Monica, anything else from your side? So yes, most of you have given me the correct answers. So let's see. It's not been so the positive advantages are basically, you know, that it makes the learner to be engaged with you. Second thing, as madam was telling in the last 2 classes, that there are visual learners, there are those people who can hear and understand those things. So here the video is mostly adaptable to all of the, even there are visual learners or what are the other type of learners, all of them could come at the same place and they can imagine in the same way. And this we will always remember. We will not forget things which we have seen and like a story or the way of demonstration. So these things we will never forget. So it engages the learner. And then if you're going to give a copy of video to the learner, so they can learn it in their own pace. They can repeat the video, they can relearn. So it does not mean that they have to learn during the class. They will also can learn and put the video again and again and learn. So they can learn in a self-paced and self-based learning could also be initiated when you are giving a video as a mode of learning. Since everything has advantages, so surely it will also have some disadvantage, isn't it? So what could be they? Yes, anybody in the group? So coming on to the disadvantages. Ma'am, I'm not able to share my screen. It is always coming into the same part.
No, but you are already sharing.
I'm sharing, but I'm not able to see the disadvantages.
So that is, I mean, there must be some challenge at your end.
Might be. So can I share it like this so that
you can read it? Yes, I think that's taken.
So the disadvantages could be like, I had today, like I have a set of students who have come from Bangalore where they're not able to understand English. Okay. And I'm not able to understand Kannada. So here what I could use is videos. But if the video is in English, they're not able to understand. So video has to be there in their language, or it should not have any language. By seeing itself, they should understand. That is one of the disadvantages. And you might not get a relevant video according to the topic which you want to teach. That is another challenge. And it cannot be used in all the teaching pedagogies. So where you want to share some counseling classes, you can't use videos. But sometimes in some other ways, different types of lectures or other discussions, might be you will not be able to use a video. And then if you want to take a video by your own, you need to spend a lot of money, hire people, script it, edit it. So it is not so easy to create a video. And playing video should also use a lot of bandwidth. So you need to have a good infrastructure where you can show the video. You should have an LCD, a projector, a Wi-Fi system, on all these things. So it's not easy to use videos in each and every condition. So these are some of the disadvantages. Then coming on to do's and don'ts. So the right and left hand sides are the do's. Whenever you want to use video as a introduction for the learners to pick the content of the story, content of the lecture, you have to mainly select suitable content for the learning, which gives the best outcomes. You cannot, and you have to receive the feedback as soon as the video is over, so that to understand whether the content, the quality, everything was good with them. They could have understood it well or not, so that you can improvise the video in the coming lectures. And then third is pause to ponder. So you can have a lengthy video, but it does not mean you have to run all the videos and then ask the question. You can stop the video in between, ask the questions, and wherever they have doubts, clear it and then go ahead. So it gives you a better understanding of that topic. And while coming on to don'ts, you have to select video which does not have a sensitive information. Like, it should not talk on politics, it should not be talking on religion, or it should not be talking opposite to your audiences. So that should not be taken. That sort of video should not be selected as a medium of instructions. Then ambiguous videos. So some videos will not give you a conclusion, will not give you a moral, and each group of people can give us or share some other information which we are really not aiming on. So ambiguous video should be avoided. And improper content related to the age of the learner. So if you are giving a learning to students of 10th standard or smaller, then the content should be different. It should not have more abusive language, violence, or sexual content. So depending upon the age of the learner, the video has to be selected. So these are some of the do's and don'ts. So any questions, group?
So Ramya, yeah. I was about to say that if you could stop sharing this screen.
So the pedagogy was on the video sharing or the teamwork?
The video, it was on how to start a topic interestingly. There are a lot of ways you can start a topic interestingly. One is video. Second is asking questions to the learner so that they become interested. Third is showing them a big statistics. Like, if you want to talk on suicide, so you show them a statistics. Every day this many people are dying. So they will create an interest. Then fourth one will be then giving them some truth of surprise. So daily you know it, but some truth are not, you're not knowing. Yes.
I think right now in this session, we are focusing on video as a way of, introducing a topic. So she wanted to introduce the topic of teamwork. So she showed that video and she made us ask questions about what do you understand. So I think the video was quite self-explanatory. So we got an idea that you're going to talk about teamwork. So she was trying to tell us about the different, video as a pedagogy. That was
Right.
Of course, she has a list of other pedagogies also that she must be using with her audience. Yeah, thank you. Any questions about video as a pedagogy? How many of you use videos? You use it. I find it very useful. Even I use videos, and a lot of time, like for example, these 4 styles of communication, I use my videos. I made those videos in my clinic with my staff. But it was easy for me to explain, see, this is how we all handle situations differently. So empathy, for example, again, it's difficult to explain, but if you show them video, it's very easily picked up. Good behavior, bad behavior, if you want to show, if you have to set up videos, very quickly people will be able to, find even the finer details of what was not appropriate. And then ask questions. Videos should always be, during debriefing, ask a lot of questions to the audience. They will give you answers what exactly you were trying to tell them. So having a discussion after the video is a very important thing. But of course, it has to be chosen very carefully. It should be culturally suitable and should not have any ambiguous message or a lot of time when we pick up a video where a doctor and nurse are fighting and you ask, tell me now, what you see is right or wrong in it. There can be a conflict because of this. Somebody might say the doctor is right, somebody might say the nurses are not right. So there can be an argument. So pick very neutral topics as a video to have a discussion. But that's an interesting way to start a topic or even end a topic. Videos can be used even. I use empathy video as an ending of my topic. It really leaves people with that thought that okay, people are suffering and we need to be more compassionate towards them. Thank you, Ramya. I think it was a very good presentation. Thank you so much.
Thank you, madam.
So with this, I think we will end it. I know we have really gone way beyond the time. I really don't know how to say sorry and apologize for it, but then credit goes to all of you for the discussion that we all hold, and then it goes on. Let's meet next Saturday, and feedback for my session I will be sharing in the group. I request all of you to send your feedback by tomorrow. Thank you so much. Bye-bye. Good night.
Thank you, ma'am. Good night. Good night.